vacation. Yes. All right. I need a motion to approve our 12 points agenda, please. All right, Mr. Van Landwit. And a second. All those in favor, please say aye.
Aye.
Any opposed? Okay, I also, I know the minutes from our last meeting are in the folder. I hope you all had a chance to review those. Does anyone have any corrections or amendments to those? If not, then I'll entertain a motion to approve the minutes. Mr. Gottschall, second. Second by Dr. Barris. All those in favor, please say aye. Aye. Any opposed? Okay, so before we move on, I just want to say that I really appreciated the fact that we had public comment last time. I appreciated hearing from all those who showed up and shared. After some thought as far as what we were discussing this meeting, as chair, I think I'm going to move the portion for public comment after our discussion so that you guys are able to comment on the discussion that we have today that pertains to the things that you are interested in. We would, of course, not make any decisions, if there were to be any decisions made today, until after your public comment portion. So with that said, we're going to move on to the next agenda item, which would be number 6, review and discuss committee meeting procedures and meeting time. First thing I wanted to discuss there was that it was brought up during public comment last time, the question of why we're not doing the Pledge of Allegiance. And I just want to say that I apologize for the oversight. In many of our meetings, besides county board meetings, it isn't standard procedure, and I just wasn't aware or didn't think of that as in regards to this meeting. Did not mean any disrespect to the veterans or to the flag, and so I apologize for that oversight. And unless anybody on this committee has an objection, I would like to start doing that at the beginning of our meetings. And I would also say that our senior veteran on our committee, Don Seep, has volunteered to lead us in that, the Pledge of Allegiance. So if you guys would all stand with me. Don, are you able to lead us?
Yes. Thank you. Can you hear me?
Can't hear you without.
Don, are you still on? Okay, Don, I apologize. We don't have your feed right now, so maybe I'll ask Mr. Renish too.
United States of America, to the republic, which stands.
All right, thank you. Next thing I think we wanted to talk about was the meeting time. So I don't know how long ago it was that we switched that time, but we used to meet for Health and Human Services at 9:30 in the morning. I think some of the reasons for changing was to allow staff to have time to prepare in the morning. However, this came up again because with the combined committees, we tend to have slightly longer agendas. And we've had a lot of discussion with budget issues. So the question was posed, do we want to move our meetings times up again and to 9:30? It would still be on the same date, the second Thursday of the month. So I would like to hear from you as a committee and also from the veterans portion of our committee, because I know that this is a different time frame than what you guys were used to meeting. And then also from the HHS staff, if you feel like that's not feasible. So I guess maybe we should hear first from Health and Human Services staff of what you guys think.
Madam Chair, I'd like you to know I'm back on and present.
Great. Thank you, Don. I apologize that we couldn't hear you for the pledge.
Well, I'm sorry you couldn't hear me. Sorry I can't be there, but I have a bad cold and I know people are not wearing masks now, and I certainly don't want to spread my germs.
Well, we're glad that you could join us online.
Thank you.
So we would be fine with moving the meeting time to 9:30.
All right, so committee members, now's your chance to give me some input on what you think.
Madam Chair, I would be all for that.
Okay. Anyone else have any strong feelings one way or the other? Dr. Barris?
What's going on? My preference would be 9:30.
Okay. All right, and those of you who were on, I guess you were on the Veterans Committee, Sherry or Lee, do you have any comments on that? Okay.
I guess this would be more to be determined by those who come in from work. Many of us are retired or, are able to do this, but for those that come in from work, I think it should be up to them.
Okay. So I know Tim and Carrie, sometimes you guys have conflicts with meeting times. Do you feel like 9:30 will make it more difficult or less difficult?
I work night shift, so I get done at 7 o'clock in the morning. And if I did have to work the night before this meeting, it would be helpful just to stay up for that extra hour or two. And
Okay.
but I am flexible as long as it's during the daytime. I have to get back up at 5 o'clock to get ready to go back to work, so the nighttime wouldn't work as well. But
I didn't hear after 5 p.m. as an option, so 9:30 or 10:30 is fine with me.
Okay. All right, well, it's not like we need to make this a resolution, but perhaps we would like to vote on this. So I guess all those in favor of moving it to 9:30, please say aye. Aye. Any opposed? Okay. Yes.
just want to say why we went to 10:30 was because of during the pandemic. I believe the EOC was operating
yeah.
at that time,
That's right.
and that they wanted to delay our time to meet so they could get done with that meeting and then come over here.
Okay, thank you for the clarification. Okay. All right, so that moves us to number 7, review and discuss the 2023 VSO budget. So those should be the items marked number 7 in your packet. CVSO not.
I just want to go ahead and apologize ahead of time. I'm at a disadvantage today. I'm a little bit skewed. My laptop decided to misbehave. I'm not sure I'm going to have Dave look at it. I'm hoping that with a timeout over there, maybe it'll start working again. So if you have any questions, I'll have to turn around and look at the screen to answer. I apologize again ahead of time.
Anybody have any printouts of those documents? Oh, perfect. So maybe you could look at the printouts and kind of walk us through the documents.
Are you looking for the proposed budget or the as is now? The monthly budget or the proposed budget? I'm sorry, I don't have the,
Well, the first one that we have in is 07 expenditure budget comparison.
okay. So I have that, printed in front of me. The 10.5549, talks about the salaries as they come out of the grant, the $9,348.14.
Oh, I'm sorry. Are you on the ones that have blue on them?
Yeah.
Okay, I think the first ones in our folder are the ones that do not have blue.
Okay.
Do you have?
Okay. Okay. So you're looking at just the budget comparison sheets for 5549, that talks about the salaries as they come out of the grant. Did you have any questions on those or?
Yes, Tim?
Why is the 2023 request lower than our 2022 actual.
Wait, are you on the,
Oh, I
are
see.
you on this document, Tim?
I am not, I'm on the blue document. Sorry. Thought we were going to the blue. Hold that question.
Okay, anything else on this one? I think the second page, so the first one had the salaries down through the, said veteran service grant on the bottom, and then the second one breaks it down. It says veteran service project at the top on the left,
Or the grant, you mean? Or the project?
project, yes,
Okay, that's the second page.
okay,
It talks about the salaries that the county pays.
okay.
And as we discussed in the last meeting, additional money from the grant could go straight into the salaries. It used to all go towards salaries, and then the state modified the grant process so that you had to have specific line items the money was being spent on. So it went from 100% that you could use for salaries to 50% to 25%. And then everything kind of got skewed, and then they went back to not making demands on where that money went.
So on the top, if I can ask okay, so I see where it says we're at for 2022 as of June 30th, and then revised budget, is that for 2022? When it says revised budget, that line, is that our total budget for 2022?
Yeah,
Okay, and so then the 2023 is right next to it.
yes,
Okay,
the request.
so under registration, it went from 500 to 625. What is registration for?
Registration for the conferences. And the reason that it went up that 125 and postage dropped the 125 is because in May of next year, there's going to be a national conference that's being held in Madison. So we can forego the two conferences and just the one. However, since it's a national conference, the registration fees go up. But we're going to be saving on hotel money. We're going to be saving on everything because we'll be driving instead of having to spend that money out.
Okay, any other questions on these particular documents before we move to the ones with blue? All right, so the first one I think that we have in blue has salaries, regular salaries, part-time are the first two account descriptions on them.
The grant. Is what
I
you're-
don't know, it doesn't say that on ours, so.
On the lower right-hand corner, the $9,348.14, that's the grant.
Grant money that goes towards those, okay? And so then the next page, which would be the one that has at the bottom, a total of 76,149,
Correct.
that's what the county puts in. I'm just wanting to make
Yes.
sure I understand.
Yep, that's
Okay.
correct.
Okay. All right, so this is similar information, it's just laid out a little bit differently. Okay. Questions from the committee? Tim, did you want to ask your question?
Yeah, just for my own understanding, so for the 5549 document, the grant document, the salary request, the regular salaries has went down from 2023 to 2022. I was just wondering what's the rationale for that?
Oh, man. I remember I'm sorry, budget season has been a blur. I remember why we did it, but I just, for some reason, I think it had to do with the FICA. They got adjusted, and some of the money went there. And then there was the raise. Tammy Wheelock and myself worked on it. We had to adjust some numbers, and so it came out of those totals are just what comes out of the grant.
Sure.
So that money got moved around. And I swear it had something to do with FICA plus the 5%. But, and she asked my permission before she did it. It was a lot of accountant talk, but the numbers figured out in the end. I can
Sure.
have a better understanding. I apologize. I'm everywhere.
No, it's totally okay. And
Um,
I see the part-time allotment went up a little bit.
And I
Not
had her
quite.
take that out of mine.
Okay, so it's not quite 1-to-1, but it's negligible. And I just wondered if there was if you mentioned that more, I think you said that they reduced the restrictions of what you could charge against the grant. Is that right?
Yes,
Okay.
about three or 4 years ago, they reduced it. I had
Okay.
some of my line items, as you can see all the zeros on the bottom of that page. Those were the things, that the technology, and the new equipment and the veterans outreach, those were all line items that the state made us put in there. And that's where that money was supposed to go. So that's why you see all the zeros, is because that's when they changed it, and I no longer had to do that, so it went towards salaries more.
Okay, thank you.
I see in advertising, you got a $600 request. Could you give us an example? What are we doing for advertising?
Sure. So advertising under that call, goes for business cards. We use it for signage, signs such as Richland County Veteran Service Office for like the fair. I've also put together brochures for the DOT, the DNR, some of the benefits that are covered on websites, but that aren't covered like on paper. And so, Heineck Printing, it gets a large chunk of that money, because that's what we do, is we make all that information so that we can distribute it, but they get the majority of that.
Yeah, I realize these are minimal things we're talking
No,
about,
absolutely.
but we're at a
please.
point where every penny, we're gonna have to look at every dollar. So, thank you.
Yeah, so with that in mind too, because I don't want it to seem like we're picking at pennies here, but because every department's under scrutiny for all of these items. When I look at the second one in blue where it talks about, I know you mentioned the state conference, so it has registration, meals, lodging, and mileage. Are those numbers mostly due to like conferences? Is that what those are reflecting?
So I do not charge the county for mileage. I save that for staff if they
Okay,
want
so
to
the
use
mileage
it.
portion is not in there.
So, yeah, I was told, 0%, a 0% increase. And so some of that money goes back, to the county into the general fund every year. As you can see, the past years that are actually charged versus what it's budgeted for, but it's there just in case.
I guess what I'm looking at is there's a line item for registration. So in 2020, it said $160, and now for 2023, it's $625. So
Correct.
I'm wondering where that's a bit of a jump for 3 years.
It was, the reason why is because of the national conference. They have higher cost fees than state conferences do.
So in 2020, were we not attending a national conference?
No.
How often are the national conferences?
They're held every year. We had a staff member go to one in South Carolina. I attended one in Green Bay and in San Diego.
Okay. Are these like, are
But-
these needed for your credentialing?
Yes,
The national conferences are?
because you only have to go for 1 week, whereas if you go to a state conference, you go for 2 weeks.
Okay, but what would the state conference costs compare to the national conference when you look at the time and the money?
It's half, but the time involved is missing 2 weeks out of the office. The door is closed. So instead of, if you just go to nationals, it's 1 week and you're done.
Okay. All right, and so then that number would include the meals would be in that portion as well for the national conference. That includes the registration and meals are both for the
It would
national
be more
conference.
expensive. We skip meals because it's too expensive.
No, I'm just saying in these line items, when we're looking at those, that's for conference. Is that correct?
But yes,
Okay. All right, and then I think one other question I had was on the last one where it says aid, 3,000. I just didn't know what that is.
that's the county tax levy. That's the money that the taxpayers pay. It's covered under the state statutes.
Okay.
And that's,
So why doesn't it reflect in the other years then?
the fund has not been used since 2014. I've never used that fund because there's a lot of state money. And so I've never had to use it. I save it for Red Cross emergencies.
Okay,
And then there's an application process. So we haven't used it since 2014 because I've been pulling aid from from the state itself, not the county.
okay, all right. Anyone
Madam
else?
Chair, this would be for Karen and possibly Clint. I know there's 72 CVSOs in the state, but is there any opportunities of potential future grants that would offset some of our budget? I mean, we're thinking outside the box here. We have to, so.
No, actually, that's a really good question, and thank you for bringing that up. So if you saw my document, what I've asked for is for the benefits specialist to be postponed, to be terminated until 2027. And part of the reason is I want to watch the veterans population to see if that estimate continues on. But the other reason is because Tammy Baldwin has got something going through the Senate right now. It's called HR 4601, Commitment to Veteran Support and Outreach, the CVSO Act. And what that is that would give federal money to the state, to the counties, so that it would give funds to veteran service offices. So there's federal cash out there that that Senator Baldwin is trying to push through. And that would be another reason to extend the benefits specialist position out to 2027 to see if those funds come through. And we're really hoping they are. I spoke with the president of the Wisconsin CVSO Association, and he said that it would definitely take time to trickle down, but that it should be out by 2027. And then the other one is there's cash out there available right now, and it's called the Rural Veterans Coordination Pilot. The main branch kind of in the state there's a little one out of Toma, and then there's one out of Madison. I volunteered and I sit on that committee so that when the grant money starts trickling down, I can find out how to process that. So there are things in the work. I am trying everything I can for the best of the county and my veterans.
So I can only imagine that some of these grants are probably limited to, since our CVSO office, it could possibly be deemed ineligible. So I encourage out of the box thinking about applying for the grant somewhere else, possibly from HHS, since they provide services, and then somehow get it back, since we're a joint committee now, somehow work interaction with HHS. If they can apply for a grant that Karen can't, then we have you do it. Somehow we get the money. It's all in the same pool. I know we can move it around somehow. I don't know how to say that properly. Fudgeability. Those are the things, that's where we're at. That's all I'm just encouraging. You know, if they say, no, you're not eligible, well then Trish is. Okay, so somebody here is eligible. That's all.
Okay, I think if we could go to the next document, it's the last one under number 7. This is the one that has breakdown of the salaries. Was there anything you wanted to explain or talk about on that one?
No, just any questions anyone has. That's the incorrect sheet.
What?
That is an old sheet. That's the 4.5%. That's not the 5%. I'm sorry, the old ones got placed in the folder.
Okay, so those numbers would change slightly to reflect 5%.
Correct.
Okay,
They did change, and I promise I put them in there, but yesterday was the committee folder had some problems accessing it.
So, Madam Chair, what I noticed from last night examining this packet at 1, 2 in the morning, that when I got here today, I had to re-download everything. So between 2 o'clock in the morning and now, something changed.
that's
Yes.
because, thank you to Angie Risner. She went in, I probably butchered your last name. She went in and put items into where, like put numbers on them so they matched our agenda. and formatted them a little bit so that we could see them more easily. So that's where those changes came in. So the actual information should not have changed. It's just where they were located to match the agenda and how their formatting was. If that makes sense. Oh, okay. Which one was extra? Because I think I synced right before. Do you know which one was?
Yeah, so added this morning should have been,
Well, the last one, the staffing comparison, right?
that one was,
Yeah.
the resolution response summary was added this morning for HHS.
Leave.
Oh, and I know I did have a question that I forgot to ask you before the meeting, and this is kind of jumping ahead, but the one that says number 10, directive resolutions, no, 10A, isn't that an old resolution because it doesn't have the cumulative amount? It had the 350,000. Okay. Yeah. So anyways, when we get there, I'll address that one. Right, which we asked that for you for referendum meeting too, so I apologize. Okay, so anyways, back to this sheet. There would be some slight changes to reflect the 5% increase. Any questions from committee? Okay, if not, we're gonna move on to number 8, which would be the HHS 2023 budget.
Okay, so this is this form that Jamie has up there. This was originally presented in August, and we are presenting it again with the updated information. Since that time, the insurance information has changed for salaries. The wage increase went from the 4.5% to the 5%. And one of the other changes we made is there was the original ask to reclass the youth aid worker that we removed from this request. Couple of just things that I want to note with children and youth child and youth services, there was a jump there in the 23 budget versus the 22 budget. That was because we did the wage increase and the reclass for those social workers. And we did do the decrease in placement funds per the request of the of Clint, and so we did put that into there. If there are any questions in regards to this, please let me know.
So am I correct in remembering that the placement fund request tax levy went down? Yes, okay, I see
Yes,
that at the bottom.
Yep,
So that part went down, the other part went up just, okay.
correct.
I have a question.
Yes.
Because of the times we live in, you have been working short-staffed for a while. Are we finding that maybe this can be we can maintain this staffing level as part of our ways to reduce costs?
Some yes, some no. One of our huge staffing level decreases is in our behavioral health unit. And so we're going to have to get staff added there through, and we can talk about this more later, but we are looking at making some changes for there. One of the positions we're looking to eliminate is the crisis APS worker. So that's a for sure one that we didn't include in the budget this year that had been previously, correct? And we're looking at making some other adjustments in the future. One of the things we really need to look at, like our child and youth services has typically been understaffed. But we have found that when we have that unit understaffed, placement costs tend to go up because there's not the staff to provide the interventions with the families. So we need to be careful in regards to that. One of the big picture things that we are going to be looking at is when there is an open position, really taking a look at, is this position needed? Do we need to fill it? There are a couple of positions in our long-range planning that we did say we could eliminate or at least postpone filling until we get a better idea of where things are at.
So does that basically all departments fall under, don't we have like a 90-day reeval process before we rehire on each job description or?
It's not automatic. We've done that with some of our positions here recently. But
Okay,
it's not
it's not
included in the
automatic,
policy.
okay, but it's kind of what it sounds like what you're gonna do, so.
Yeah, some of them have to be automatic if they're mandated by the state that we have to fill them, or if it's a one-person job. But if it's, I guess an example is in our administration unit, we'll take a look at, what does that position do? Can those job duties be absorbed by someone else? Really take a deep dive into all of those when we have open positions.
Great. Any other questions from the committee? Okay. So as far as for items number 9 and 10, so number 9 is review and discuss mandated versus non-mandated programs / services in Richland County. And then number 10 is review and discuss 2024 to 2027 budget levy reductions per resolution 22-96 directives. In my thinking, we kind of need to look at those together, as particularly when it pertains to HHS. And I did have this discussion with Tricia. So the document on mandated versus non-mandated, it's number 9 in your folder. And it was a long document. We're really just looking at the ones that are specifically related to either Health and Human Services or to the Veterans Office. So I'm not quite sure how you want to handle that portion of this discussion. I think we'll start with the HHS budget levy reductions. Kind of my goal here today, I think as a committee, we need to, discuss what progress has been made since the last meeting as far as looking at, remember at the last meeting, I think we were at like $655,000 still in reductions that we needed to make before the 2027 or by the 2027 point. And so what we need to look at today is what further has HHS come up with. Do we have further questions? Is there more information that we need on any of those? And then start a discussion on what items might we want to look at putting towards the referendum. I don't think that we necessarily need to make any decisions today. We may just want to give some more direction prior to our next meeting, because then at the next meeting, we do need to we need to make a decision on what do we want to include for the referendum ad hoc committee. So 9 has, and I believe it was Melissa and Sean, if he's on, he can correct me if I'm wrong, that kind of compiled this list. And I know that Tricia and Stephanie did look through this when they were preparing the budget levy reductions document. And then when we look at 10, so 10 has a lot of extra items. I mean, there's a lot of items under 10, so it's like 10 and then 10A, 10B, etc. So my question or what I was looking at, it references resolution 22-96. And I believe, and I apologize that I didn't have the current one in here, but I believe the one that we have is the one prior to revision by Finance and Personnel. And Clint or Tim, please correct me if I'm wrong. Jamie, if you can pull up 10A, because currently what it says is, or on this document, what it says that the Health and Human Services, this is on page 1, is specifically tasked with, and I'm going down to number 2, a total projected levy operational expense reduction of $350,000 entering into 2024 and the same sustained reduction beyond. That was old language.
Correct, it's been updated. I can, give me just a minute, Madam Chair. I can.
Yes, thank you. If you could just reread that for us, the updated one. And I know we discussed this at the last meeting, but I just want to remind us of what our goal is for our committee. I did see that, so we could look at that one, I guess.
So it'd be 10J.
10J. Okay, so we're briefly going to look at that because it does have the resolution language on there. So the updated resolution language, if you're looking at 10J, which is up on the screen, we were specifically tasked for Health and Human Services and the Veterans Services to develop a recommended list of proposed projected levy reductions in comparing to the 2022 budget, not 2023, of $320,000 in 2024, $637,000 in 2025, $783,000 in 2026, and $1,004,000 in 2027, including but not limited to lines 1.01 through 1.92 and 17.01 to 17.92 in the 5-year financial plan. Again, I want to comment to make sure that you guys all understand that is a cumulative reduction, okay? So each year, what you reduced the previous year would be added on to that total. You're not adding on. So for example, 320,000 in 2024, that's going to carry over into 2025. And then the difference to make up the 637 is what you need to look at for 2025. Does that make sense? It's a cumulative total. So cumulatively by 2027, $1,004,000. Okay. With that stated, going back to looking at what we can do for, I think we'll start with Health and Human Services.
Okay. So in this document, we did review this last.
This is 10J, correct?
This is 10J,
Okay.
yes. We did review this last month, but there were some tweaks made and some additional changes to get us to those numbers that are being asked of us. For 2024, the biggest thing that we changed or updated from last month is a behavioral health restructuring. So part of that already began last month when we converted some of the mental health therapist positions into mental health case managers. That was some cost savings for the department. But the other piece in this is that we are looking at, instead of having the 2 remaining mental health therapists being full-time, we are looking to have them be contracted. And so we would pay them an hourly rate for the time that they are there providing services. So that is one cost savings that we could implement, but we're also looking to have that on the referendum if the committee approves that and supports that. So we would like to have them continue to be full-time positions, but as a cost savings, we could have them be contracted positions where they are not receiving the benefits and they're paid for an hourly rate and only in the time that they are working.
Could you say it again, which positions those were? I'm looking on the referendum, item 110K.
It would be the number 2, the 2 mental health therapists. So we wouldn't be eliminating those positions. We would just be making them contracted. For our outpatient clinic, we do have a mandatory minimum number of hours that we would need to provide. And so we would need to have mental health therapists, but we could just lower the number of hours of services that are being provided to the community. To use a microphone. Make sure you get a microphone.
I just want to clarify too, when we say cost savings, it gets really muddy in our budget because many of our positions are not 100% tax levy positions, right? So when I say savings, there is savings in that some of the funding that we are using for these positions, we can reallocate to other possible tax levy positions that we can then reduce the tax levy needed for tax levy positions. If that is even making any sense. I just want to clarify, when you say cost savings, I don't want people thinking that we have all these positions that are tax levy positions that we're just trying to eliminate. Does that make sense? Or postpone filling? So there is savings, tax levy savings eventually.
So what happens
I
is.
know, I'm sorry to I just don't want you thinking that we're going to save $172,000 worth of tax levy by virtue of not filling those positions. If that makes any sense, or maybe I should have just kept my mouth shut. I don't know.
What happens is we get a base county allocation. And so that gives flexibility to be used throughout the department and throughout the different positions. So some of the base county allocation is used for these positions, for the therapist positions. We can then take some of that money out of this and be using it in other departments, other units, other positions.
So which line was that reflected in? And was that you were saying in the 2024?
That would be in 2024. It'd be under Fund 56 in the last line, the behavioral health restructure.
Okay, all right, I see that. Thank you.
Yeah. One of the other things that we added is yearly we receive a Soar Grant, and that's a substance, it's a state opioid response grant. And
Where's that one at? I'm
that would
sorry.
be
Oh, I
on,
see it. Next
okay,
page.
yep, on the next page. With that, we are going to be allocating some of those funds to the health department for them to be providing public education. And so that will be less levy that will be needed in the public health department. And these funds can be used to provide public education. And then we looked at 25 through 27. Really the biggest change would be in regards to our placements. And we would be asking that they be added to the referendum. Those are really the toughest ones to plan for, to budget, to guess, because we're dealing with people. And so that is the biggest spot that we could make adjustments and changes. We're really hoping with different changes within the department, different staff coming in, looking at different responses to these, that we can adjust some of these. It also, with the child and youth services, working on terminations quicker and getting those to pass through quicker. Sometimes we have cases open for a couple of years before we can get those completed. And so we'd be looking to, if it's appropriate, having those happen sooner rather than later. And so then these children are not in foster care for as long. We did remove the purchase of a new electronic health record system. We do have a current system, and we will just maximize and use that one that we have.
That's under Fund 56.
That's under
Make sure
Fund
everybody's
56.
tracking.
Yeah.
Tricia, I have a question before we move on. On the closing out the placement cases, since the clerk of courts is also in the same predicament that the rest of us are, is this something that the clerk of courts can work with you to expedite these cases on behalf of the county's budget?
So it's really about that cooperation with the Corporation Council and working with them. And we've started to work with Mike Windle on some of these because we do get extra funds from the state specifically for that. And so that is something that we've started to implement, and we've already started working with Michael on one of these cases.
Can you, for the benefit, I know the members of the committee are familiar with this, as am I, but for the benefit of the public here, how much does it cost to send someone to Winnebago State Hospital?
I think it's 1,000 a day, 1,200 a day, 1,200 a day, 1,500 a day. A lot of money. Under Fund 56, the postponing fill-in positions due to attrition. So that's where we've looked at, there are a couple of positions that we are really looking at that upon retirements, we will really take a deep dive and look at, do these positions need to be filled? How can we make the department run without having those positions in place? Are there any questions in regards to this document?
Yes, specifically, I know not a lot of the committee has, I had a chance to sit down and kind of talk with Tricia over these, but many of you did not get that chance. So please, because this is a big portion of our discussion, ask, if you don't understand something on here, please ask. We need specific questions and direction as we move forward here.
Do have one looking forward to the 25, 27 reduction options. Fund 56, remove request to purchase a new EHR, and then maintenance, I'm assuming on the building. Could you elaborate on that a little bit? I know we're stretching out there, but the reason it strikes up my attention is that if we kick maintenance down the road, it's just gonna bite you in the butt down the road.
I think what that one is, and Stephanie, you can correct me if I'm wrong, we're hoping to have a whole new HVAC system put in that year. So right now we have budgeted in repair and maintenance of that. And in repairing a unit, I believe we have budgeted $6,000. And so we could pull that out if we have a new system.
So that is not what I meant here.
Okay, never mind.
No, that's okay. Maintenance for the EHR. There's annual maintenance costs and yeah, for maintaining that software system. So that was
about the
yeah.
$100,000 under
Yes.
Fund 56.
Yes.
Okay. And that's-
Yes, and that was an ask on our wish list when we submitted the, earlier in April or whatever. That was our ask on the wish list. So we were saying, yeah, we can cut that and help assist in reducing levy needs in those years. So
Okay, well, along with the maintenance, then I know we've talked about HVAC and lights and all that. We need to look at, we might have to spend the money to save money. If you've got an outdated system that you're paying exorbitant amounts of utility bills, I'm always like cost of return. If it can pay for itself, 10 years is the life of your system. As long as your payback and your utilities is less than 10, you've got a good shot of getting my attention. But if you're trying to stretch it out over 20,
it's my understanding
No.
that the new HVAC is in the borrowing request.
it's a CIP.
Yeah, yes. Yeah. And with utility costs increasing, we've noticed about $1,000 a month in our electric bills over the last probably 3 or 4 months. So
One of the other items that we have on here that we do not have on here, but that we will be looking into is our income maintenance, so our economic support unit. We will be having some discussions over the next couple of years with the Capital Consortium. As you know, we have those additional workers. We are going to be asking for potentially getting additional funds to support the workers versus the percentage of population that we have. We just didn't build that in here, but those are additional things that we will be looking at in the future.
So for the benefit of the committee, because I don't know if everyone understands this, when you say percentage by population versus how many workers, could you explain that a little bit more?
Yeah, so right now, Richland County, per population should have 5 workers and a supervisor in our economic support worker. About 8 years ago, it was decided to bring extra workers to Richland County because it is cheaper to have workers in Richland versus some of the other bigger counties like Dane. Those are covered by the consortium. And so what has happened, though, is we continue to receive funding based on our population. So based on those original 5 workers, based on the 15 workers that we have. And so we will be talking with the consortium to try to get, because we're doing more of the work, to get a bigger piece of the pie.
Okay, so right now on this sheet for 2027, you have us at 1,000,000, almost $7,000. What do you feel like is the most variable as far as, I know there's, some of this is very difficult, right? So what do you feel like is the most variable where it could really impact that number?
Placements.
Okay, is there anything else on there besides placements that you think is tenuous? And the total placements, by the way, was 300,000, is that correct? Between Fund 44 and Fund 54?
400.
400?
Total of 400,000, I think. Is that what you're?
Oh, I guess I'm
Yep.
looking at 2025 to
Yeah,
2027 was
yep.
300,000.
Plus the
Before that,
100,000. Yep.
Okay, 100,000, thank you. So was there anything else that you felt like was particularly tenuous in those numbers? Okay, so then when we're looking at, well, first off, anyone else have clarification questions or things that you think need to be dived into further on this? Yes, go ahead.
You may be going down this road, so if you are, I can pause this consideration, but I agree the 400,000 in 2027 is the most volatile and has the biggest opportunity to change somewhere in the next 5 years. And I just wonder, and maybe asking rhetorically at this point, but I wonder if by not proposing a referendum question outside of the money that we're saving in the placement reductions, are we are we limiting our options in the future if the placement funds don't end up the way that we think they're going to? I mean, we've made a commitment that we're not going to keep going back to the public with referendum questions. We'd kind of like to get have this be a one-shot deal for at least the next 5 years. If we're banking on that 400,000 to make up our difference and not proposing a referendum question, are we limiting our options?
So
That
you're
makes
saying,
sense.
you're wondering if that needs to be included on referendum?
No, not included in referendum, but if let's eliminate them from consideration for a moment. We get to 2027 and we only have 600,000 in reduction from the current plan. Now we don't have a referendum and our options are extremely limited.
So you're saying don't take placements into consideration when we're making this together?
I don't think I'm saying that.
Okay.
Because then we don't even have $1 million tax levy in our budget.
Yeah.
And then you remove the MOEs and we're at about 300,000 tax levy total, so.
I agree.
We-
Do we owe it to the public for their consideration that could be that could be a reality in 5 years.
What could be a reality?
That placements didn't pan out the way we wanted them to. The savings isn't
Right.
there.
So now we have.
We categorically don't have enough money in our core budget to, if we turn the lights off and lock the door, we would not make up the difference.
Right, and just to make it clear for the public or anyone else who's listening, we don't have an option on placements. We have to pay those costs, so it would have to come on somewhere.
Madam Chair?
Yes,
Yes, absolutely. We don't have an option. And I think that's probably the most dangerous variable that we're dealing with. We have no control over, or very little control over placements if they're court ordered. And I think that I think we need to be very careful with how much savings we're planning on in terms of placements. It's completely an unknown, really.
So then that brings me back to my question then the $1 million ask of tax levy cut is 100% cut of tax levy from all health and human services programs, mandated or non-mandated. And we would have to, what? So that's just what I'm just saying, throwing that out there. It's an extreme thing, but
it is, but I think we need to discuss that.
yeah,
So
right,
I guess
exactly.
I know we went through that mandated versus non-mandated document, but if we're taking that out of consideration and we're talking bare bones, what would be the other options?
So things that we looked at, we talked about the mental health therapist, having them contracted and really just having staff there to provide the minimum to keep our outpatient clinic going. There is levy in treatment court. There's levy in our coordinated service team. We have technology in there and we could, cut the technology budget that we have. Our aging programs and transportation, we can cut them, but only to a certain amount. And so we still have an obligation to submit tax levy towards our aging program. So even if we make the decision, okay, we're going to go bare bones on nutrition program, there still is levy that has to be put in, that has to be matched. We have that obligation with the state to do that. And so we do have it in there that we could cut it because we do have a little extra levy in there. But I want everybody to understand that our nutrition program is bare bones because we also have ARPA funds in our nutrition program right now that will be gone when this all starts. And so asking to cut that will be cutting significant services.
So are you saying that you already have that nutrition cut in here? Or you're saying you had that on another thought process?
No, it's in there.
It's in there.
Where?
I thought it was.
It's on we had
Sorry.
it originally in the first year and then we were able to.
Oh, I see it in
move
Fund 59?
Yes.
5,000?
Yes. Yeah. Fund 59 and Fund 63.
What about the other things that you were mentioning.
So treatment court, I don't think we worked that in here, correct me if I'm wrong, we didn't work that in here?
Let me,
Well,
I brought this. This is my working document. Treatment court. Treatment court pushed out to 26. So I might not have broken that out specifically on the list. Yeah, I didn't break that on the list specifically on here, but yeah, we put treatment court in there for 26, 27 as a cut. Coordinated services team pushed that out to 26, 27 as a cut.
So I guess what I'm wondering is if we're taking out, if, as Tim commented, if we're taking out the $400,000 as something that's very, very variable, do we have any options for, I know we're stating this, but is there options? I know it would looking at each department, but
So you're saying an additional $400,000?
right, what are the worst case scenarios? Do we as a committee want to see those options also presented?
I think one of the things that Stephanie was trying to say is our total levy, so if we are not looking at placements at all, our total levy is under 1 million.
It's what, if you look at the
It's-
2023 budget document,
Which one is, oh, okay.
the one that we shared earlier.
So our tax levy,
The number 8, is that what we're looking at?
yeah,
$956,085.
so if we don't look at placements,
Can
we
you-
don't.
I'm sorry.
Okay,
Can
I'm
you
sorry.
show me where that's at?
Yep, so if you look at this form, and it's
Oh.
in,
Okay.
yep, 2023 tax levy, the 956,085. That is all we get for tax levy. I shouldn't say all, because that's a lot. I apologize for that. That's what we get for tax levy. That is less than the $1 million ask. And so we have to,
Which we were able to, in this proposal or potential reduction response, we were able to find $600,000 to reduce that 956,
Yes.
right? Down to what, 300,000 or 400,000, all purely on hoping that we're, making the changes in the behavioral health clinic with that restructure, not filling positions due to attrition, which is all variable too, right? I mean, what if nobody ever retires? What are you gonna do?
the other piece of this that Stephanie mentioned is we have a match mandate for
Mhm.
some of these programs. So we have to have these programs for some of them, and we have to contribute county funds to these programs. So
Right.
like the Adult Protective Services is an example, our nutrition program is an example.
So you could not cut that number down to 0 is what you're saying?
Correct.
Correct.
Right. Okay, so committee,
Don't we,
Madam
Madam Chair,
Mr. Steep,
don't we have a matching grant for the court treatment system?
We are mandated to have a match for treatment court. We are in a 5-year contract right now with treatment court in the state, so I don't think we could get out of it, and that's why we put it out till later on. But
Mhm.
again, it's a worry that we would be cutting a valuable service to the community. I did have a meeting with the judge yesterday and talked with her about this long-term, but that is a concern that we.
Which could impact placement funds depending on
Yes.
where they are and, you know.
Yes.
Yeah, I'm new to the committee, but you're asking we're asking our staff and this committee to predict the future. We can sit here and debate it all day long. Getting back to what Supervisor Goschel said, I think if I'm reading what he's saying is we need to make sure that maybe take that 400,000 out and show cutting it somewhere else, someplace we really can't control, just for the fact of the levy, to make sure we're covered in our referendum. Is that kind of what you're saying? You want to make sure we're covered in the referendum?
I
Predict
honestly,
the future.
We have to find the money somewhere.
I don't honestly think that there is anywhere to show a cut, to the point that Tricia and Stephanie are making. And that's maybe the broader point I wanted to get to is, do we want to consider a referendum question that somehow accounts for that $400,000? not, there's nothing to show to cut. There would be no question to put on the referendum. We need to make I'm speaking loosely, of course, but we need to make up $400,000. We're going to cut these things if you don't vote yes. Such a question doesn't exist because we don't take $1 million in tax levy.
Right, and there's not a way to cut down $400,000 more. You're saying we're already at $300,000.
And it's still a huge guesstimate anyway. I
Right.
mean, really, and
Is there something else on levy, maybe that is not even,
in the
Uh,
HHS.
excuse me, something else that we want to put to referendum that maybe isn't even on this list of cost reductions to put out to the public?
And I'm going to jump in here. The fear with that is, Supervisor Murphy Lopez said if we put it to referendum and it fails, it's cut.
I understand
Well,
the brevity of that situation,
if you
but
wanted to ask.
I think the referendum committee would much rather us produce something very tangible that could get us to where we need to be in 2027, instead of getting there and saying, well, actually our placement costs, we ate up the 400,000 and we went to 500,000 actually, or something like that. I mean, those aren't, we're not living in reality if we don't consider that happening.
Would you like Supervisor Murphy Lopez? Are you still on? Are you able to speak? I don't know if you want to add anything to that or have any thoughts for our committee.
Yeah, I'm here. I think that, yeah, I went back to remind myself, what's the total HHS draw off the property tax levy? It's 2.4 million.
Yeah.
So one thing I was thinking is, our placement cost 1.4 million. Is that the current cost?
Yes.
Yes, they're saying budgeted,
Okay.
yes.
Okay. I do think that another avenue we probably need to explore, and I asked Mr. Langreich to look at this, because Supervisor Severson brought it up to me, maybe another supervisor, I can't remember who was in this discussion after the last county board meeting, but we need to ask about those placement costs and how was it that the state moved those costs over to the county? When did that happen? I think we need to be advocating on our behalf to the state as well, just like we are with shared revenue with placement costs. I agree, we can't put the placement costs on the referendum. If the referendum fails, we're still going to pay the placement costs. So then people are going to the public will feel like we weren't really going to follow through with what we were asking them to fund if they indeed don't fund it. So let's give them some things that truly are optional, things that are non-mandated to put on the levy. That'd be my preference. And this is my opinion. Of course, we could go down the path of putting something on the levy, and if it fails, still funding it. I just don't think that's a good idea. So I'm not just trying to say my way is the highway. I'm just thinking out loud. That's kind of the way I think we should be working with the public on this, my personal opinion.
Murphy,
Madam Chair.
Just one moment, Mr. Steve. So I agree with you, but as far as approaching the state or lobbying for that, I mean, that's not something, while that should be something we can pursue, that's not going to answer this question before referendum. And what our understanding is that there isn't more cuts that we can make that equal that $400,000. So how do we get around having that on the referendum? Am I stating that correctly?
Madam Chair.
Mr. Steve,
Madam,
Mr. Steve, can I have Mr. Murphy Lopez address my question first?
Madam Chair, I do not know the answer to that question. I'm not sure how we can get around it. The thing that I would be curious about, looking at all this stuff here, is how many staff does this mean? What does it mean staff wise? Because I think this is a little hard for me, and I haven't been here at the whole meeting. I'm running in and out. But just looking at what's in front of the screen now, it's a little hard to understand what would the staff cuts be with these proposals. So I think we have to make that clear to folks as well. But yeah, I don't know how we would get around it. I'm not sure.
Okay, so perhaps we need to kind of segue into that staffing discussion, and then we can come back and decide if there were some other directives. Mr. Steep, did you want to ask your question?
Well, my only observation or comment would be that if the referendum fails, we have no other option other than to borrow money on short-term borrowing. If we have done all the efficiency cuts that we can do, we need the money to pay for the placements, for example. We have to borrow money to do it on a short-term borrowing. We're back to that again. There's no other source.
Thank you, Mr. Steep. Mr. Gotchell?
Yeah, just to be, Don's not insinuating this, but we wouldn't be able to borrow on short term for placement funds.
Right, that was my understanding.
For capital, so it would have to happen somewhere else. Supervisor Murphy Lopez, that just hearing the discussion in the last 10 minutes, do you think leaving the 400,000 as our solution for 2027 meets the spirit of what we're asked to do here?
I think so.
Despite the fact that that is variable?
I do believe that some of those costs are within our control. I know it tends to kind of be an either or proposition. Sometimes we can control it, we can't control it. But I have heard ideas thrown out in various meetings about how to control some of those costs. So I do think if it's something we can cut. I know it's challenging though.
Fair.
Okay, so from our committee, before we move to the staffing levels comparison, which I will probably ask Mr. Lopez, Ms. Murphy Lopez to speak to again. In regards to the document that we've been looking at, remember what number that is. Were there other directives or things you would want to see before we address the question of what goes on referendum at the next meeting? Mr. Van Landwit.
Is it possible to hear from the county board chair and the county administrator briefly about their thoughts on this matter?
I would welcome any comments.
Marty and I are having to stare down. Who's going to go first? No, I appreciate all the work that's went into this. This is the nature of, unfortunately, kind of where we're at. The conversations need to be just this uncomfortable, if not more uncomfortable. That means that we're doing due diligence and looking at it. Like we've talked about in many of our meetings, we're kind of past a situation where a lot of what might be considered good options are kind of gone. We're into the bad options kind of a ground. And by that, I mean, not necessarily on how your feelings are about service, but good, bad being kind of in context on the majority of people kind of agreeing that we can do without those types of things. So the nature of what's being asked to be brought forward from you folks back to finance and personnel, and therefore then potentially considered out for referendum are items exactly like this. When we start having conversations on if we're going to adjust for placements and put everything towards that base budget, what is that going to look like? I don't want to be the doom and gloom person in the room, but without structural change at a state type of a level, that's the ceiling that we're going to continue to butt up against. I appreciate that the referendum effort is kind of we're looking at trying to fix this problem for potentially out to 4 to 5 years with putting a levy exemption in to go above that to give us a respite in being able to deliver a lot of these services that we still cherish and that we deem very appropriate for our community. But without structural change to state level, like we've kind of alluded to, this conversation is not going away. This is going to be part of the annual budget process on what do we want to do without, or what do we want to do very much less with. So I appreciate the nature of the conversation, the discourse, and all the homework and investigation that was done into it. Does that satisfy your request, Madam Chair?
And I would add that placements, I was in the committee, on the HHS committee, the day that the then director of HHS came in and said, oh, by the way, we're not going to be able to cover these things in our normal budget. So we're drawing funds now out of fund, was it 54? And yeah, and it was such a shock to all of us on the committee. And apparently, they'd been able to, by shifting things around and eliminating this, cover those expenses for a few years. And we really weren't aware of what was happening until that day. It caused the committee chair to resign. In fact, he resigned from the board totally because it was such a shock to him. So anyway, a long way to explain that placement services, placement of individuals has long been a problem looming over HHS, and to just ask them, and this is the one reduction in the current proposals that bothered me the most, because I know that you just can't, it's easy to take pot shots at HHS. Oh, well, it's a black hole, boy, we're money hand over fist. And of course, that is not true. And but the more that we cut from essential services and programs, the less money we'll get from the state, because so much of it requires a match, so much of it requires staffing. So, you know, and this is the message we're trying to send to the state. We've done some things through the counties association. We do some things talking to our own state representatives. And one of them has commented, well, I can't comment on it, it's a local problem. Well, to hell it is. It's going to be your problem, because we're trying to shove this toward the state and get them to finally, the governor, I was at a conference last week, the governor was there and bragged about the I think it's $5 billion now, $5 billion surplus. And we've been able to reduce people's income tax. Well, so what? We're trying to increase their property tax. And I'm not an advocate of increasing taxes. I wish that we had a reasonable revenue sharing in many areas, not just the amount they give us each year, but also in many of these programs, because there are a lot of hidden things that they don't account for. Well, we gave you some money. Well, yeah, but to get that money, we had to jump through hoops and establish programs and spend our own money. So we've got to get their attention. Thanks.
From going off of what Marty said, back in 2017 is when that happened. And I remember that distinctively. And what we ended up doing, and Tim can probably attest to this because he was an employee at the time, we made some strong budget cuts within there and removed some positions around, some therapist positions and psychiatric. And then in that time frame, then the next year when that was implemented, we seen a major increase in costs because we eliminated those services. So we think that maybe we're doing good, but actually it's going to cost us more money in the end. And I got looking at this sheet here from the ad hoc committee, you know, with Sean saying it was 2.4 million is what the county tax says, but we're bringing in 7 million. That's funding our offsetting the costs that what are truly here. So if we start cutting more, that revenue is going to go down the hole. And then we're going to get even more increasing costs. But then we're going to be cutting even more within the county to try to make this budget work, because we're forced to do it. And I don't like mandating, because I'm done with that now because of what our senator said, but they're forcing us to do this.
Yes, I would agree that it's sometimes difficult to quantify, you know, what a reduction in cost now will cost us later. When you're talking about services such as the Health and Human Services provides.
Well, then it gets back full circle back to what we originally started this conversation, was placing that reduction on placements, because that's, well, it's kind of mandated, but it's non-mandated, because it's mandated, but we don't get money for it. So we're back to square. We just did a circle.
So, oh, yes, Administrator Langbeck.
So coming back around to the same place we started in, which segues to a comment that I mixed. And I don't know the answer to this. I think, Director Clements, we've talked about this previously and just lightly brushed on it. the placements for adult and for children, are those considered court-ordered or judgment events?
Yes, most of them are.
Okay.
Yes.
So in recognition again of where counties and local governments are, Wisconsin Counties Association recently released out an advisory, kind of knowing the financial situations that we're in with all the different levers and options that you have. So one of the releases did indicate that underneath state statute 67.045, one of the available tools that you would have in your toolbox is that you can borrow, you can do notes or bondings for such actions as to comply with court-ordered judgment. So if you are in a situation as another type of a release valve, if you have some types of massive placements that were unaccounted for, statute has given you now, or the state has given you that release valve where you can go and take municipal notes for it. Again, at least that same type of a situation where you have kind of an operational cost now that you're putting on your charge card, it's still going to impact the tax base and the tax levy as an exemption and more added tax burden. But you potentially have a lever there to help cover some of that risk liability, if you will, if that's fair to say.
Madam Chair.
So then that answers Tim's comment or concern then, and we can look at it as a referendum, as a budget fix. I don't want to do it. I don't want to do it that way.
Referendum, we're saying we could present this as we have met the requirements of the directive of the resolution, correct?
You do, but now there's other elements too that we know that we can push towards notes as well. So then that becomes kind of an management challenge then for Marty, Finance and Personnel too on, well, how much projected liability do we think that we're going to be kind of alluding to with our short-term borrowing actions? And you can do that. The balance, the check and balance on that is, of course, from your constituents on voting and all those types of elements. But the other thing that hinges on, and of course, you know, this is it requires a 3/4 vote then from county board of those seated in order to engage into that type of borrowing.
Madam Chair.
Yes, Mr. Steep.
For Mr. Langrick, is that ability to borrow money now in the law, or is that a proposed bill?
So the statute referenced is Wisconsin State Statute 67.045, and it is already passed. Now, I don't think that it's been largely exercised. So everything is kind of put forward as this is a face value. If it was to ever be challenged in court, we don't know how that would line up, and I don't think that we have any type of Supreme Court opinions on it as well. But it is a tool right now that is, I don't want to say being promoted, but Wisconsin Counties Association is making counties aware of it in their challenges of trying to find financial solutions.
So we don't have any examples of people who have used that option.
Not that I'm aware of underneath context for court-ordered or judgment items.
Thank you.
Mr. Renish first, then Mr. Severson.
It seems to me, there again, we're getting back to predicting the future, but Tricia, didn't I see somewhere in 2019 or 20, did we have a budget surplus in placements? Albeit small, but it was a surplus?
We've had surpluses from our core budget, not necessarily from placement budgets. But
Right,
from core
but what
budgets.
we've been asked to do then is to use our surpluses to offset any
Placement expense.
any overages and placements. So that has been on Health and Human Services to cover.
And that's some of the things that are hard for us to predict too, is sometimes after the fact, the state gives us additional revenue. I know with like our income maintenance, that happens almost every year that we get additional revenue. The next year with our Medicaid reporting process, we get additional revenue. We can't always guesstimate how much it is. We do, and we put it in our budget, but that can change what we thought we would get versus what we get. So sometimes when we have those overages that we return, it's not because we didn't spend our budget, it's because we received more than what we thought we were going to.
And typically, what are those overages in a range of?
I know last year was around 400,000 for 2021.
I thought that was wasn't there some exceptionality to that?
There was, there's a list. I'd have to dig up the list on what those all. or from. It was a
It was
variety of things.
Current economic support, I believe.
WIM
were
current
the
economic
biggest ones.
support were the major ones, yeah.
Okay, Mr. Severson.
Just kind of mentioned what I was-
Okay. All right, so to refocus us here, we're going to look at the possible referendum items and then also talk about the staffing. But before we do that, for the next meeting, when we are going to need to make a decision then on the referendum items, do you need any, as a committee, is there any more information or anything, any directives that you have before we move on? Mr. Van Landwit.
Thank you. I'm not certain that this is pertinent, but I think it goes along with the same scenario we're dealing with right now. I'm from Henrietta Township. And Henrietta, years back, when they kept the tax levies low for our township, others had left them higher. And when the state gave money to each of the townships based on the revenues, we got less. So we kind of screwed ourselves by leaving things down, and the other ones did much better. So it takes them longer to repair things. So I'd like our committee here to be very careful what we want to cut, because if we get ourselves down to the point where the state will give us less and less, we're going to box ourselves into a corner. So I hope this, relates to what it is that we're doing, but the state, I agree with Marty, that the state is the problem here. They're sitting on $5 billion, and there's many communities, many counties, townships, cities that could use that little extra to get them over the hump, and we are definitely in that position. So I would, the county association maybe go after some of these legislators that are kind of sitting on the budget right now and not sharing with the rest of us. So that's all I have to say. Thank you.
Before we leave the topic completely, a lot of us on the Finance Personnel Committee are sitting here today, but I'd like to forward that understanding that we have for the new revenue source for potentially levying placement funds, just as correspondence or something,
Oh,
or
okay. Would you like
Mr.
to make
Chair,
that a motion?
can we make it an agenda item at our next Finance and Personnel meeting?
So would you like to make that as a motion then?
What would you recommend?
You don't need it as a motion. Okay,
That's fine, yeah.
perfect. Okay, so then that takes us to the 10K where the possible referendum items. We're not gonna make any decisions today, but I do want to look at that together, hear your thoughts, hear the committee's thoughts, and then we'll move on.
So what we have put together to request to go to referendum is the APS crisis worker. Yep.
No, I'm just scratching my
Okay.
back.
The APS crisis worker, the 2 mental health therapists. So instead of having them contracted, be full-time. There is match in the children's long-term support, waiver program, treatment court, our coordinated service team, our technology budget, our aging programs and transportation, and placements. That's the list of items that we are asking to go to referendum. And we wanted to get your input in regards to that. Now, things like treatment court, I think we have budgeted 27,000. We get 130,000 for that. So it would be a loss to, like we've talked about, you're losing then additional revenue. Coordinated service team, we get 30,000, we contribute 12,000.
60.
Oh, I'm sorry, what did I say? Oh, 30. We get 60,000 and we contribute 12,000. But those are the items, to me with the aging program and transportation, if we gut those programs, our elderly population is not going to have that resource and that connection. So that's a very important one that I think we need to make sure we're adding to the referendum and doing whatever we can not to cut. And honestly, over the next couple of years, we will need to be adding levy to that because we're losing those ARPA funds.
Comments or thoughts from the committee?
Madam Chair,
We,
One moment, Mr. Steve.
the treatment court, is that Isn't that something new, just started, or has that been around for a while?
I think it's been 3 years. Yeah, I thought
We've just renewed, right?
We
That
just renewed.
The contract.
we're in like the third year of the.
Right, and expanded.
I think it was 2017 is when we started that
Sorry.
with Judge Sharp.
Other questions? Oh, Mr. Seep.
Madam Chair, I forgot my question.
Well, maybe you'll think of it. I have a question. I know we had mentioned the potential for adding on nutrition onto here. Did we, what are your thoughts on that?
so. We do have the aging programs. That's part of
Oh,
that's
it's
nutrition.
included in
Yes.
that. Okay,
yes.
thank you for
Yep.
clarifying.
Oh, that was my question.
Well, there we go.
Uh, the, the nutrition program, does that include the meals for seniors?
Yes, it does.
Ouch.
Yes, ouch. There's a lot of ouch in this list.
Yes.
Okay. All right, well, I know we're gonna go on to talk about staffing levels, but I just wanna say, I thank you guys at Health and Human Services for the amount of hours and work. I know this was a lot of your time above and beyond what you have to do on a day-to-day basis to prepare this. We asked a lot of you and you really delivered, and we really appreciate that as a committee. Thank you for putting such hard work into this and preparing this for us so that we can make some informed decisions as we move forward. This has not been easy, so I appreciate that. Thank you. Okay, so now we have some documents. Let me go back and look here. I believe it's 10L through 10P that are regarding from, I believe this came from, or it did come from the referendum ad hoc committee to kind of look at staffing levels in comparison to other counties with similar population. Supervisor Murphy Lopez, are you still on? Is there anything you would like to state before we go into that preliminary discussion?
I believe he left already.
Okay. Oh, and welcome, Ms. Ruderstorff. I'm sorry that I didn't see you before. Okay, so I guess I will try, hopefully I won't butcher this too much. So if we look at 10L, they had prepared a public education information report, which we do have just pieces of that in our document under 10M and 10N. But one of the things that came out of that public education information report is there was a staffing comparison chart in there, and it compared our staffing levels to many departments in the county to other counties that have similar population as us. Obviously, for our committee, what we need to look at is our departments. So the Health and Human Services and Veterans Standing Committee. I believe Mr. Murphy Lopez's request was that we look at that because on his preliminary research, which was just kind of calling and seeing, you know, straight out, what are your staffing levels in your Health and Human Services department, it appeared that we have a staff above and beyond what some similar counties were, and we're going to look at that document. Initially, the number, so if we look at, well, let's go to 10M. Not the updated, the first 10M, and scroll down to page 3 of 3. This is the chart that I'm referencing. So third line down, or third or fourth line down where it says Health and Human Services, and it lists Richland as 75, and then it looks at Bayfield, Burnett, and Kewanee, which would be the ones with similar populations. Grant would not, and neither would Sauk. We have 75, Bayfield 47, Burnett 47, and Kewanee 43. All right, so first off, this did not take into account that initial number, the extra staff that we have in our economic support unit, that is due to us being that part of that consortium that Director Clements referenced. So those extra positions were because of that, and those are already covered by the money through the consortium. So if you take those out, I want to say that puts us to what?
69.
69. Okay. And then I know Director.
Minus 8 is what? 75. 9. 75 minus 8 is what?
66. My goodness.
It'd be 60.
We're all struggling with basic math here.
66.
Thank you.
66. Sorry. I'm so used to
My fifth grader would be ashamed of me. But anyways,
66.
okay. So, Director Clements has prepared some information on how that looks when we're actually comparing, when we look at services provided and what's provided or not provided in other counties. So that document is 10P. Is that what you would like to discuss first, or did you want to look at anything else?
Yeah, so with the HHS employees, our actual number of employees right now is 69. I think he had 75 and he had included the 15
Mhm.
economic support workers on this document. But what we did was with those 3 counties that he provided to us, we went on their websites, we reached out to them, we looked at their annual reports, and we compared services that were provided. And so this document really takes a look at what services those counties provide versus which services our county provides. And so when you look at that, our comparables are actually, we're pretty comparable with those counties if we were to eliminate those services. So an example is the outpatient clinic. We have 4 workers in the outpatient clinic. Some other counties don't have that, and so you would eliminate those. Some counties have the ADRC in with their health and human services, others don't. So those 7 workers that we have with our ADRC, and then the one with nutrition and the one with transportation, those aren't added into these other counties' numbers because they're separate departments. Same with public health. Not all human services are a health and human services, and so they have a separate department. And so we really tried to take a look at that and get that information to you so that we are trying to compare apples to apples as best as we can. So an example is the CCS program. We have 9 staff currently allotted for our CCS program, and 2 of the 3 counties don't have that program at all. And so we just really wanted to make sure that that people are aware that we have services that are connected with the staff that we have.
So,
Madam
when we're
Chair.
one moment, Mr. Seep. So when we're looking at that, were those some considerations that you did take into account when we're talking, mandated versus non-mandated on those budget levy reductions that we looked at?
It really is. And, Stephanie and I had a lot of long talks about, okay, do we look at eliminating the outpatient clinic? We could, but then we lose our, we get mental health block grant from the state, so we lose those funds. But we also then look at potentially increasing our placements because we don't have the staff to support the people in the community. And so we really did take a look at all of those things. And again, some of them are small matches. So if you look at CST, it's only 12,000, but we get 60. And so we really did take a look at all of those items.
So then as a clarification, the revised staff comparison on the bottom,
Yes.
those numbers on the very bottom, 45, 41, 36, would that be our numbers in comparison to them?
That would be our numbers in comparison to them if we, bless you, if we took their services provided and subtracted the staff for those, we took the services they did not provide and subtracted our staff, we then are pretty comparable to them and actually understaffing numbers to most of them. The other thing that I think it's important to realize is through our staffing numbers, we have our custodian. Some counties don't have that within the HHS budget. Some counties have that in a building and grounds budget where it's completely separate. Same with HR. Some counties have an individual HR department. We have HR, we have payroll. Those are services or items that are provided within our department that in other counties are provided by their own department.
Okay.
Madam Chair,
Oh, you're back. Hello.
I am back. Sorry, I lost you. I just want to just point out that I think those emails that I forwarded you yesterday from these various counties should be
Yes.
sent to Tricia because I see.
I did forward those. Thank you. I personally didn't have a ton of time to dive into them because I was trying to prep for some of the other items, but I do want to look at those, and I believe I forwarded all of those to Tricia.
Yes, I did
Great,
receive.
because I see some inaccuracies in this chart versus what we heard from those counties. So ADRC, every county has ADRC. I think maybe we should look at that public health one as well. That
So-
jumps out to me, so.
So every county does have an ADRC, but every county doesn't have the ADRC as part of the Health and Human Services Department.
I understand that, and I included those. I asked the Kewaunee County Administrator to tell me how many employees there would be an ADRC under that contract, and he told me 7, and I added those to the figure. So those are included in the staffing comparison.
Okay,
Okay,
we'll take a look.
so
at that.
I think, because this came to us very late, and I know that Director Clements did not have a lot of time to look into this, and Mr. Murphy Lopez, if I can speak for you, I know you had mentioned you'd be willing to have a meeting with Tricia, and she mentioned the same thing. So I think maybe best course of action would be to meet and to really go over these numbers together and then bring that back to look at our next committee meeting in a little more detail. Does that sound reasonable?
Yes.
Okay. Is that, I mean, will that satisfy your committee's directive, Mr. Murphy Lopez?
Yeah, that would be great to meet to get into these in a little more detail. We just referred the numbers to you all, but
Okay.
I do think there needs to be more digging. I think it'd be good to get a list of all the positions in the various HHS departments and compare them line by line to really understand what's going on here, because unless I'm missing something from my quick look, it does look like we're overstaffed. And so that's what we need to get to the bottom of. Is that true or not?
Okay, so I think we will continue this discussion at our next meeting. I am going to mention a couple of things. On 10M, the first one, page 2, I just want to mention that this was something that I believe was done by Cheryl. It looks at just a few different positions and how we compare the ones that relate to HHS. It was interesting to look at. It appears we're at the bottom for, I believe, all of the ones that would fall into an HHS department. So the child support specialist, the child and youth case manager, and the economic support specialist. So it gives a picture kind of where our wages fall in comparison to some of these other counties. The other thing I want to mention is the first page that has broken down by department the number of employees. The HHS staff amended that portion to update it with accurate reflections, and that is on 10N. So it does change just where they're allocated a little bit, although the total and fixes the actual number as well. Okay, so unless anyone has other questions, I think we'll continue that discussion at the next meeting, which then brings us to looking at our Veteran Service Office, the budget levy reductions per resolution. So those are going to be the other 10s, the previous 10s. So 10B through 10I.
Madam Chair?
Yes, Mr. Steep?
Yes, somehow I didn't get my comment in on the subject here.
Oh, I apologize, Mr. Steep.
That's all right. With regard to ADRC, in effect, there's no county money or levy money spent on ADRC staff, with the exception of some money that funnels through them. It's a pass through for, I think it's the elderly benefit specialist. So in effect, you know, they could be looked upon as not being part of our staff because they're paid for by the state.
I'll defer that.
There's no county levy money spent on ADRC staff.
That is correct, Mr. Steep.
I don't know
And
why we're
that's-
counting them.
I mean, I think just initially we're just looking at number of staff. Those kinds of discussions need to happen as we really talk about how do we compare. So yes, we'll definitely take that into account.
Because that's a false comparison.
Yes, I understand what you're saying. That's why when we look at, and I don't believe Mr. Murphy Lopez intended that. He also acknowledged that when you look at this initially, it's not necessarily apples to apples. We have to go back and do some digging and really look at department by department within an HHS, what the numbers are, how they compare, what services do they offer, et cetera, which I believe is what Director Clements is attempting to do. And we will we'll continue that.
Richland County could have an ADRC totally independent of of Health and Human Services in another building, for example. And they do in some counties.
Yes. Okay. I'm sorry, was there someone else who wanted to speak? Mr.
Madam Chair,
Markio?
I was just going to add that those other counties have ADRC included in their totals. So no matter where the funding comes from, the numbers are in there. Now, if there are any errors, we need to get to the bottom of that and we need to look at it in more detail. But comparing apples to apples, you can't just pull out our federally funded employees and not pull out their federally funded employees. So that's the digging that needs to happen.
Yes. Thank you. Okay. We postponed it a little bit, so yes, go ahead, Ms. Knott.
These are the numbers of the options for reductions that I am proposing from
Okay, so
the,
this is item 10. I'm sorry, I'm just to make sure everyone's on the same page. Those of you on your iPads, it's 10B.
so the first one, I'll read it since some of the people aren't here, can't see the screen and don't have the iPads. It comes out of the 5551 budget, and it would be the cemetery flag holders. That is not a mandated service. Some of the counties around us have already had to give them up due to budget constraints. So that would be one of the things that the budget could give up. It's last year it was budgeted for 1,500. This year I budgeted at 1,300. And one of the ways that it might impact services is that families come in for those flag holders, and by doing that, they learn of all the rest of the benefits that are waiting for them, such as the burial flag, the funeral benefits, the bronze plaque, etc., different cemeteries, things like that. So that's where the impact would be. We already do this now, but we keep brochures available for families to order their own. If the first one has been destroyed by the cemetery, lawnmowers are the death of these things, then the families are asked to pay for any replacements, but we do issue the first one. So that's the first item.
Question on that before you go to the next, please. Madam Chair,
Yes, Mr. Seep.
how many flag holders did you have to put out last year?
Last year alone,
Yeah.
I would have to get those totals.
Okay. How much does each one cost?
$31.60.
Did you put out more than 10?
Yes.
Okay.
Trying to ask if she utilized all the money that was budgeted for flag holders last year.
So for flag holders, if I could go a little bit
Yes.
more into detail. So if a family says, my dad never received one, my great grandpa never received one, I know this guy's a veteran, but he never received one. I go through all my paperwork in the office and I have to just determine if I can prove they've ever been issued one before. And if they haven't, then I will give them to that. So I deal with veterans with these cemetery flag holders from the Spanish-American War, Purple Heart, Department of the Army, all the way through Iraq, Afghanistan, Korea, World War II, every different one. So, and then determining whether those veterans are getting that it takes time in the office. So there's man hours that go into the whole process as well.
Okay.
So,
But as you said, Mr. Seep, one moment, please. So as you said, these are not necessarily mandated. So you were asking to have this it's a possible reduction that you would like us to put on referendum.
Correct. That's
Okay.
the last part I was getting to. Yes, I did ask for it. I know that I feel that some people would be upset if we no longer give those out. I know that cemetery officials would not be happy
Okay.
with that at all, but it is, like we said, hard choices. So that's definitely something that we have to look at.
Okay. Thank you.
my question is, you issued the first one now at no cost and you charge for the second one.
We don't sell them. We give them brochures to where they can order them from.
Okay, so the first one you authorize to them, right?
Correct.
Okay,
Okay, thank you. Move on.
so
Thank you. So the next one, is since there's no longer a Veteran Service Office, commission specifically, there would be no need for that per diem. I do want to keep some of the money. It was allotted at 900 just in case of emergency. If there was some reason that, like, again, the Red Cross, and if we had to have that commission meeting to justify the aid funds. So that's when the commission would come in. So I did leave some funds in that, but not nearly as much as I would need. As I said, that aid fund I have not used since 2014. So that was just, it would be a reserve for just in case. The next one is, oh, and then I'm not recommending that for referendum, and it would have no impact on services, just as the next one. The mileage reduction, I'd still like to keep some funds in there. It wasn't much. It was $222 would remain in there. That would just be a reduction. Again, that would have no impact on services. It not for the referendum. The next one is we have a computer program that all of the 72 states have, and we just purchased it. It's $900 when we signed up, and a year later, they've already raised the cost to $918. I contacted them, and they told me that the contracted price of $900, which was what it was supposed to be, that they're just going to continue to raise that. So there is a workaround. We would have to have every veteran in the county that comes in that wants to file, we'd have to open them their own va.gov account, and then we would have to work through it, and that we would that's how we would apply online for them in a similar way. A majority of ours get faxed straight to the regional office right now, and the ETK program, if we were to give that up, that's the only consideration that we would have to give for that.
Can I ask a question?
Yes.
Does it, if you didn't have that and you're having to create a special account for each veteran, is that going to create a lot more time for you, which then maybe those costs are not really, is it negligible?
No, so the thing with the ETK is you have to create them an account as well. You have to log
So
them.
what was it saving you? I mean, what was the benefit, I guess, of having that program?
It allows you to direct upload everything into,
As opposed to, I'm sorry.
like I said, right now we're like faxing most of ours in
Okay.
because they go straight to the direct regional office. Whereas if they're uploaded online, then really know what regional office they could be going to. It wouldn't necessarily be Janesville. So that's why we're fast tracking it. However, the director Honeycutt from the regional office in Milwaukee has stated that he's considering ceasing faxing. So that's why we really needed to up our game and utilize something else for when we file those claims. That's why we did the Tyler Industries ETK. It's the same one that the Richland City uses, Richland Center uses, and it was blessed by our MS department.
So if we don't have that and you go to the other option, are you still faxing?
No, that would be if the faxing completely stops.
Okay, thank you. Didn't understand that.
So that would be another one that, like I said, that we would have to consider, especially if they've already raised their prices $18 just in the first year. And so that would be 2024 that would hit the budget. And then the final one is the elimination of the benefit specialist position. That price would be the $22,738.64. It's actually 23,000. I'm not sure how I typed that number in wrong. And that would be, it's already budgeted for 2023, so it would start in 2024. However, what I would like to, I would like the committee to consider, not only this item for the referendum, because I feel it's important. I would also like them to consider, if the elimination is going to happen, that it happens in 2027. Again, so we can monitor the population and we can look for those federal funds that are coming in to justify that. And then, so that's why I've listed it on there, to please extend it until 2027 so we can monitor the population. And then the workaround is, two assigned people from Health and Human Services. One for answering phones and one for, filling out claims. And so that's why, it's listed on there that the reduction would start in 2024. However, we'd like to see it put on the referendum and extend it out till 2027 so we can do a better estimate on how it's going to affect, as I said, the veterans population, and the federal funds that we may be receiving by then. We would know by then if we're going to receive those federal dollars.
Okay, did you want to address the service impact portion of that?
It would definitely, the service impact would be the different, we'd be only able to work one case at a time, without the benefits specialist. It would cause my duties, since I would be the only accredited person, it would cause my duties and responsibilities to increase greatly. Somebody that is not accredited and is not trained would struggle greatly with filling out these forms. You really need to be trained. It's to become efficient in this job, it takes a full 4 years of on-the-job training. I would have to, somebody that's not trained professionally, and I would have to try to do that myself, it would put on a greater tax onto me. It would reduce services even more in the office. And then most forms would not be able to be completed unless I was there to do it.
Just as clarification though, an admin assistant could file for benefits, correct? They could file claims for benefits?
Anybody can file claims for benefits.
Okay.
The veterans do not have to come and see me. They can file on their own. However, this paperwork is a lot. And it really takes.
I understand. I just, for our committee's understanding, I just kind of want to clarify what all of your duties could an admin assistant actually help with, and then where's the line where they could not help?
We get burial flag requests from funeral homes.
Mm-hmm.
Maybe that form that they would be able to fill out, but again, you have to be able to train and understand DD 214s. Every generation is different, and it takes years of knowledge, of training to be able to read those. Every generation is different.
But they could also do answering phone calls, making appointments if you weren't there, helping with benefits claims if somebody didn't understand how to do that. Am I correct? I just
Again, that would take training,
right,
to be able to do
with
that.
Understanding that there's been some training.
And then we have an answering machine, so there would be no reason for anyone to have to answer our phone system the way we're set up. Like when you called yesterday, I was out of the office for that brief moment and we had the answering machine.
Okay. All right. So then, does anyone have any questions on this document before we get into her supporting document?
Yeah, I'm sure you track it. So how many claims on behalf of Richland County or other county residents, how many claims did you actually file in it, like an average year? How many do you do?
It's in the January file for 2022. It's uploaded in there. I don't know if
Are you talking about the WDVA?
No, this is an annual form that I fill out. It talks about all the different forms that we've completed in the year. And then it also talks about the number of office visits that we've had, calls and walk-ins. That was completed in January of 2022 is when I issued that to my last committee. It's an annual report. So again, this January, I would have another one for you.
Because I'm not sure if
It's under post reorganization, so you gotta go 2022
Oh, so it's
January.
not-
It's not in the current thing, but there's a copy of calls and walk-ins that she has down there.
Okay, do you have that pulled up?
Yeah, it says total 3,618 calls and visits were 962.
Yep. And then there should be a copy of forms.
There's a copy of forms.
And these are all records that I started keeping after Administrator Langrick came on and under his advisement.
You guys need that pulled up? Okay, other questions on this form in particular? We're gonna go into some of her other documents she has.
One quick question.
Yes, Mr. Steve?
Are you continuing to produce those forms monthly and sending them to Mr. Langreck for monitoring, or how are you handling those?
Those are an annual report and they will be posted again in January.
Under Mr. Langreck's advisement before, you were doing them on a monthly basis and reporting them to the committee. You're not going to do that anymore?
It's going to be an annual report.
I understand there's an annual report. Is there a monthly report?
There is currently not, Supervisor Seep, if that is something that you would like the body to entertain, I would recommend.
Well, there was a
future
motion
agenda
by the
items.
previous body to, has that motion somehow been ignored?
If it's something that you'd like brought for future meetings, it certainly can be done. At future item agendas, I would recommend to make that proposition.
Okay, you asked for a monthly service report for each veteran that's served. Are you receiving those? You asked that a service report be filled out for each veteran that comes to the office for service. Is that being done?
I've given CVSO knock recommendation on completing a service report on what the nature of the visits were. We had a couple different forms that we looked at. I've not received those back. I don't know if you're exercising those.
So we talked about in-office forms that I would provide the veteran themselves. Talk about their visit that day. And then the calls and the walk-ins and visits, and then the number of forms that are completed.
So who's monitoring those reports now? For you? Is Mr. Langreck?
So my guidance to CVSO knock was to, in conjunction with the service visit, to fill out loosely what had happened and then to keep that into the veteran's file. I'm not going down to the office to monitor each of those interactions. Is that your question, Supervisor Seat?
Yes, but I'm wondering how we're keeping track of the numbers of people who come to the office monthly.
I keep track of that, and then I give an annual report.
Are
And
you
the reason
keeping
why,
track of that on the form on the forms that the committee provided you?
correct. And when the committees first combined, we had a meeting with the then HHS director and Ingrid. It was a conference call. Do you remember that? When we
So.
first,
I'm
and
sorry,
that's
there's been a
that's
lot
when it
happening.
was that's when it was determined that I would still keep the records, but I would just give that annual, not monthly.
Part of that, but that's fine. Okay, I'd like to.
There was 400 forms filed last year. That's what I got for 2021 forms filed. I totaled everything up from every
Forms
month.
the same terminology as claims, or are we talking something
Well, if
different?
you want to go that route, there's statement in support of claims. There was 47 that was filed throughout the year, but there's like 20 different forms,
Every claim,
applications and authorizations and.
every claim requires different amount of forms. So actual claims, technically, if a veteran comes in and says, I want the veteran identifier on my driver's license, you have to fill out an application for that. So I have to fill out an application, I have to certify it, and then they take it over across town to the DMV. So theoretically, that could be considered a claim because it's an application. The National Park Pass, it could be considered because it's an application. The DNR for the small game fishing, those could be, and so those aren't included in those numbers.
Okay, that was my question.
Yeah.
That was
So-
27, what you just listed there, because if you add those up, the driver's license and the state park pass, that was 10, 17, so it's 27.
Okay, thank you. All right, can we move on to the other documents now? Okay,
Yes, we can, but I think it's difficult to monitor the population without having access to more information about the numbers here. Thank you.
all right, so the next one we have listed in our folder is 10C, which is I believe Administrator Langreck said you put that in there, vet population 2020?
Just as an explanation, the website that I was addressed to, this link popped up. And so I included it into the packet. However, the actual paper that shows the population and the estimated population is not included in the packet. I can read off the numbers, what's projected from here until 2020, 2030. And that will be included in the packet after this meeting is over, if anybody wants to review it, but I can read it now. So that's why this is there, and it's a good reference. It's good material, but it's not the actual thing that
That might be helpful. As of right now, what does it say that we're at?
1174.
Okay, and then if you could list like maybe the next 3 or 4 years
Yep.
projection.
So if you're, right now we're looking at 2022, and this has it listed as 1124. However, the GDX is a different number, so that's anybody's guess whose numbers are actually correct. And I can also tell you that just this calendar year alone, we've gained 20 new veterans to Richland County that I have added to their files into ours. Then in 20
So you may add in people from.
that have moved here, new veterans. And
Does
then
this number mean the number that you actually service though? Because I know that sometimes there are people that come here from counties and there are people that go from this county to other counties. So is that's simply reflecting the population? It's not necessarily how many you that are actually serviced or not?
well, they're mostly service because they've reported to my office and asked questions and we've completed forms together. That's how I'm aware of them. So there could be 100 that have moved in. I mean, that's unrealistic, but I'm,
So you're saying what's on veteran population is based on who's coming to your office. It's not based on the population that is in Richland County.
no.
To try to help clarify, so the reference document here is pointing to the database from the VA, which is gathered off the census. So the numbers that Karen is giving you from that data set is the projected amount based on census types of data.
Okay.
So then the other half of it though is the anecdotal situations where Karen is saying that there's folks that are reporting here from other counties, other states that are coming to you that you're getting a different feed for.
Moving here.
The point being that the projected numbers may not line with what you're experiencing from folks migrating
Correct.
potentially in and unknown folks that may or may not be migrating in and out.
So according to this document that I'm looking at, in 2020, it had 1,187 veterans. That is due to the census. So that is technically the only accurate number that's on this. Everything else is projected, and as Mr. Wrench said earlier, there's no way to predict the future. I can,
So what is it for 2025? What's the projection?
for 2025 is 1,036,
And for 2030?
920.
Okay.
And
Madam Chair. They're looking at a decrease of 1.6% in over a 30-year span. So it's minimal. It's going to stay around 1,000, 1,200 in Richland County. They're again predicting the future.
Right. okay.
Right, exactly.
Okay.
So when I spoke with you, you said something that, we talked about it at last meeting also, is that you wanted to know a comparison for veterans that have passed away versus how many we've lost as opposed to how many new ones that have come in.
For that specifically, I know I asked to look at counties that
The
have
number-
similar better.
The number of deceased veterans. You had asked about the number of deceased veterans versus the new ones that were coming in. So I did,
Oh, I think that might have been in reference because I was looking at these projected numbers and you had said, well, I don't think these are accurate because there are people moving in.
Correct.
And I said,
Yep.
okay, so does that compare then to the number that annually?
right, so I
passed
put those
away?
numbers
Yeah.
together. So far this year, now this is including Muscadet residents. This is including people that were put in Pine Valley but weren't actually from Richland County that are being buried here. So every 2008 flag application, so far this year I've filed 32. With 20 new coming in, and the state can kind of back up some of those numbers. But here's the thing that's important to know about the deceased veterans. Sometimes, often, when a veteran passes away, what happens to that is the rest of their family and wife now become the claimants. So just because a veteran has passed away, that doesn't mean that all of the benefits stop. So if the veteran were to pass away and the wife wants to apply for dependent indemnity compensation, then she would become the new claimant. The children want to use school benefits that they're now entitled to, then they become the claimant. And all these claims continue to go forward, especially since the PACT Act. I don't know if anybody here is familiar with that. It just came out, and they've given benefits to so many people that weren't eligible prior. Also, Blue Water veterans from the Navy in Vietnam, Desert Storm veterans, Camp Lejeune veterans. If you served at Air Force bases in Pennsylvania, Ohio, and I don't remember the other one. But all these new things, they just came out last month. All these new people are eligible. And then back to the spouse, there's the property tax credit, which we currently get. We have 44 of them in the county, and the Department of Revenue is like $114,000 that they put back in the pockets of the taxpayers. That's direct into the taxpayers' pockets. So just because the veteran has passed away, that doesn't mean that I didn't just get 3 more claimants due to that passing. So the numbers are increasing even though they look like they're not.
May I ask, how many DICs have you had in the last year?
Gary, do you have that on that?
Out of that.
Okay, it's on that 2021 report.
Is that what does DIC stand for?
Dependent indemnity compensation. It's when the family tells the VA that my husband died from ischemic heart disease after serving in Vietnam, because that service-connected death, and they would be able to receive that compensation for the rest of their lives.
So there has to be a specific correlation to be able to claim that?
Correct.
Okay.
But there are other pensions, they call it the widow's pension. I don't like that word, but, and
So do you have the
No.
number of DICs for the last year?
DIC and survivor pensions too. That was in December.
All right, can we move to 10D?
okay, so this is a possible cost savings. This is the kind of write-up that I actually put in. The cost savings that's the correct number, the 23,868.29 cents. And then there's that computer program licensing that we had discussed that I asked to be recommended for elimination from the budget, not recommended, but just as an option. I guess I used that word wrong, and that would be 450. And then the annual dues for the benefit specialist is $75 is how much we give to the Wisconsin Cvso. You scroll down. So possible increase, if possible increase, cost increase to reducing the benefit specialist. It would be taking up 2 salaries for the 2 people that would have to replace him. If I were to start charging for mileage costs due to an increase of home visits, this is how I calculated it. 60% of last year's office visits, and that would be 10 miles back and forth for the daily per mile. That's again, just an estimate, but that's what it figured out to. And then for having to be out of the office so much, I know that the county sometimes issues cell phones. And so I would like it, I use my cell phone for this job a lot now. So if that were to increase, then I would probably ask for a cell phone to be able to help me out on that.
So can I just clarify that those top 2 numbers you have there, clerical staff and phone operator, that's under the condition that we would reduce benefit specialists and you would stay housed here without staff support from the community services building, correct?
The
The
top one,
clerical staff and the
Okay.
phone operator.
that would be if I was moved to Health and Human Services to utilize their
But
personnel.
that would already be included in their budget, so it's not a cost increase for your budget.
But I would be using their services, so their salary would be in addition because they'd be doing those extra duties.
I'm not sure that's how it was presented to me when I asked the Health and Human Services to look at it. Maybe you could speak to that, Ms. Mr. Clements.
I referenced the numbers that were in that email. That's where I got that total from, that 17,000.
If Veteran Services were moved to the Community Services Building, our clerical staff would take on the additional duties.
Without an additional increase to their salaries.
Correct. Correct.
Okay, so then what I'm saying is it's already budgeted within their budget. And so if, that's why I just wanted to clarify that numbers would only be applicable if we had you here and needed to give you clerical staff in the event that the benefit specialist was reduced, because they're saying they can absorb that into their already budgeted costs.
But they have full-time jobs. These people have duties assigned to them already, so these would be
I'm
additional.
simply telling you what I've been told from the HHS
Right.
staff when they were looking
And
at it,
my-
that they would be able to absorb that.
And my understanding was that these would be additional duties on top of, for the office staff that I would need to continue services. So they would be having additional jobs basically on top of what they're doing. Especially anybody that has to train to learn how to fill out claims.
I understand that you're saying that, but the cost estimate that they gave me was that can be absorbed into what they already offer as compensation for their workers without increasing that.
So they're not working full-time jobs?
Right, so I'm confused where the disconnect is. Would you like to speak to that, Administrator?
Because
Morgan?
basically this would become a second
I'm
job.
seeing 2 different visions here. I'm seeing one where we're talking about if the CVSO office were to be here and we cut a benefit specialist and we still needed to make up to have that same, essentially like 1.5 FTEs allocated towards it, then yes. If the vision is it's moved across the street and then it becomes a 1 FTE type of a position of just a CVSO, and you're minimizing it to offer reception support and scheduling support and minimal type of service at the front desk type of support, is kind of what I'm gathering on the vision there. So in that point, then you're saying you wouldn't be charging or doing any type of journal entry across to the veterans budget. You'd be saying for those ancillary types of things, we could handle that at our service counter for reception and for scheduling and for those types of functions. Is that the visions?
Yes, that is correct.
Thank you. And I just wanted to clarify that because it
Right.
doesn't state that on this.
No,
So I
this would
wanted
be
to-
additional duties in reference to the jobs that they already have. So they should receive extra compensation, especially if their titles or if their duties change.
Well, I hear you, but what I'm saying is that you're putting that forward as your proposal for that. But what we had initially was if we look at it here and we need support there in this building, then we have that cost associated. If we move it there, then as he said, that's a different vision that doesn't include these increased costs.
Right, but it would basically be anybody that would be helping me with claims and benefits would need to be there for the same hours that the benefit specialist already has. So that would be an extra 20.5 hours that is already added to what they're working in the Health and Human Services building.
So what they're getting at is that it's an overall reduction. You're down to just a one person touching most of your claims and filing your types of your claims is what the vision is. So the mindset isn't that they're taking clerical support and receptionist folks. And we're also then going to make sure that they have all the places in place to receive accreditation and to be able to have access to BBMS and other portals.
Right, and so that's what I want the committee to understand when we're weighing the options, are those, that's what the visions are that we're putting before you and pros and cons of each. Stephanie, did you want to add something?
No, I think finally it drew down. So it's not adding additional staff to support her in Health and Human Services, and we wouldn't be increasing. You'd almost maybe think of it as an in-kind kind of, thing. We'd really be providing an in-kind service to the Veterans Office at that
Okay.
point.
All right,
Madam-
thank
Madam
you.
That makes
Chair.
sense.
Yes,
And this is the road we're going down and talking with other department heads and that stuff. Having employees for 30 years, cross-training is important. We need to have people that can multitask and do different jobs, because even if you are classified full-time, there are some times that there's a lull in your day. I don't care what job you have. So as a cost savings, that's what we're looking at, cross-training people to keep the labor force down and efficient. And so take it with that grain of salt going forward. You're going to hear this more and more. I would like to anyway, as far as cross-training, and it's what we have to do.
It's a shared service, I guess.
correct. None of this is easy discussions, and we're looking at this in this overall picture of this $7 million reduction that needs to be made by the county. And so we're having to look at department by department, what are efficiencies that can be done? What are cuts that can be made? Where can we start to? So that's where I think this discrepancy in the two visions was. That's why we need to discuss this as a committee.
Madam Chair, if I may, we're looking at overall reductions in the county. And I would say this, if you're a 4-person office, you're going to be 3. If you're a 3-person office, you're going to be 2. If you're a 2-person office, you're probably going down to 1. Not only the Veteran Service Office, but every county office.
So when I figured this up, I thought that I would have support staff. So that is correct, because I was told that there would be someone that would be able to help me file claims and run the office from a different location. So that's why the numbers are different. Yes.
Madam Chair.
Your microphone.
Thank you. I believe what they were offering was that the front desk could do things like answer phone calls, set up an appointment time for them to come back and see you when you were in the office if you were not there, potentially have some training to file some benefits claims and things like that, some help with your budget. Was there anything I'm missing?
Madam Chair.
So that was kind of the offer
Mhm.
as far as that goes. Yes, Mr. Seat.
Yes, there's no reason why one of those people and one or more of those people cannot be and also can be accredited to help with the processing of claims. Any person.
Well, that would need to
can
be a
do that.
further discussion with Health and Human Services on what that might require as far as their staff.
Sure.
So I don't think we're at that point yet. Okay,
So
let's move
yep.
on further down this document.
So the link that I had just posted, that if anybody wants to reference that online, that's a copy of the GDX that you will see later on in one of the slides. But I just wanted to give somebody the actual website. But yeah, if you can continue down. So after a lengthy background check, the Veterans Benefit Specialist is credited by the federal government permitted access to veterans' claims to quickly assess and claims as they flow through the process. They are specially trained to operate within the 38 Code of Federal Regulations, HIPAA, filling out forms when necessary, understanding how to read discharge papers and medical records, and work with the VA Medical and Compensation Pension, the Department of Defense, CHAMP VA, TRICARE, DFAS, which is the Department of Finance, The departments of the Navy, Air Force, Space Force, Marines, Army, Navy, and I left off Seabees because I think they're different, and then the Coast Guard. County offices that we work within with the county that we receive referrals from is the Sheriff's Department and Jail, Child Support, Pine Valley, EMS, Register of Deeds, District Attorney, and Clerk of Courts. We also receive dozens of walk-ins from those offices. My office should be located with the offices that I work with closely and refer people to us. Outside offices, we work with other CVSOs, funeral homes, monument companies, hospital, probation and parole, Veterans Outreach Program, the Department of Workforce Development, Wisconsin Department of Veterans Affairs, the Department of Motor Vehicles, and Department of Natural Resources. Cemeteries, rental managers, community organizations, Salvation Army, DEERS, which is a dependent enrollment system, NARA, which is the National Archives, and Passages. Those were just some of them. So this is what I would need a benefits specialist or someone to train with that would be able to help with these claims. Next. Eliminating the veterans benefit specialist would decrease services. Fewer veterans would receive in-office services. The CVSO would have to attend more outreach events alone, meaning less time in the office. And if anything were to happen to me, the office would be completely closed with no services. Also, the CVSO would have less time for department head duties. Here are some additional statistics from the VA. Almost a quarter of all veterans in the United States are returning to reside in rural communities. Veterans choose rural communities for a variety of reasons. Scroll down a little bit. The numbers, there's some percentages. Compared to urban areas, rural communities tend to have higher poverty rates, elderly rates, residents with poor health, fewer physicians' practices. We're very lucky with community care and working with the Richland County Hospital. Scroll down. VA recognizes the need to provide accessible care to rural veterans and allocates 32% of its healthcare budget to rural veteran community. 44.7 million rural veterans with 2.7 of them enrolled in the VA. There's significantly higher, 58% of rural veterans are enrolled in VA healthcare, significantly higher than the 38% for urban. 58% of rural enrolled veterans have at least one service-connected condition, and that's where we would come in with our claims. 8% of enrolled veterans are women, rural women, 10% rural veterans minorities, 44% that earn less than $35,000 annually. 27% do not access the internet at home, and again, that's where my office comes in. 55% are over the age of 65. More than 300,000 rural veterans served in Iraq and Afghanistan. So that's the population that we're looking at when we take in these benefits, because they have just started receiving theirs or have yet to. And then scroll down. There it is. So here's the report of the Wisconsin per return. If you look at the veterans credit, that's the property tax credit. There's 83 that are eligible within the state, but last year only 44 claimed the credit. So that was $112,000 that came back to taxpayers to help them pay the county for their amount owed. Scroll down. And then, of course, the GDX helps to bring in that 12.1 million. That is services and cash that goes into the pockets of our Richland County veterans. That's the services that they are receiving now. That GDX number has been on a steady increase since 2015, and that number would definitely not increase nearly as much if we were to cut our services as they are. Although the veterans population is expected to drop, the claims numbers are growing and getting more complicated. They just keep adding more forms sometimes. Scroll down. This was shown to the Wisconsin Counties Association. The veterans population may be dropping, but if you look at the claims numbers, they have risen. and the GDX totals follow those claims. So even though the population is dropping, like I said, more veterans are claiming, and that is in part due to the Iraq and Afghanistan veterans that are coming back. Okay. Some of the key demographics in the population model estimated for 2021, 5.9 million American veterans served during Vietnam, 7.8 million who served during the Gulf War, and 78% of veterans in 2021 served during wartime. These numbers all need to be taken into account when we're talking about services, because the services are only going to grow. And we haven't even begun to see the Iraq and Afghanistan vets that are coming back. It's like, I don't even remember what the numbers were, but their claims have been small because they're out in the workforce, or they're just getting back, or they're trying to deal with things on their own instead of seeking services. So that number is going to continue to grow. And then post 9/11 veterans more likely than non-veterans to be employed and earn their income. All right, next. Ouch. So I'm asking the committee to consider funding the Veterans Benefit Specialist until 2027. At that time, we can reassess the veterans population and income to see if it's following the estimate. Also, Sean Murphy Lopez gave me, I would like to follow in his footsteps. If we can finance this until 2027, plus put it on the referendum, during that time, I would also like to prepare some online surveys that local veterans would be able to go on and answer. I think he did a good job when he decided that. So during this time, we can watch the population, we can fill out surveys, and then hopefully.
Sorry, can you just clarify, what are you referring that he did?
An online survey?
For what in particular?
It had something to do with the ad hoc referendum.
Okay.
So yes, we would be able to watch for those federal funds that come in, and then if they don't come in and the referendum is voted down, then in 2027 the benefit specialist position would be cut because we wouldn't be able to justify it. But during this time, this is what I'm asking for. That is what I would like to see. And then,
Okay,
sorry.
so that moves us to 10E then. This was the one where we'd asked you to prepare looking at some surrounding counties with similar veterans population. What office staff, how many office staff do they have? Are they full-time, part-time? If they have a second office staff, what is their title?
So this, there is one correction. I'm not sure what happened, but Iowa County is not under Health and Human Services. They don't have a Health and Human Services department. So I got that one wrong. I apologize for that. But we compared Ashland, Bayfield, Crawford, Green Lake County, Kewaunee, Price, Richland, Rusk, and Taylor. And we talked about their veterans population versus their expenditures versus their office staff, and then what their titles are. Those numbers are up there. Out of the 1, 2, 3, 4, 5, 6, 7, 8, 9 counties that were compared against each other, there are 4 of them are veterans benefit specialists.
Including us.
Correct, yes. The 9 that were counted, yes. The deputy CVSO is an officer. They are considered an assistant, so if anything were to happen to the CVSO, then they would step up into that position without having to do much of anything, I think is the county. We considered that early on in 2015, if we wanted to go that way. However, the position has to be filled by a veteran. And just because they're a veteran does not necessarily mean that they're best for the job. So that's the reason why we stepped it down to a veterans benefit specialist. But it was a deputy when I first got here, and that's why we reduced it. And then the administrative assistant, there's 2 out of the 9. On the bottom, it's surrounding counties, Crawford, Grant, Iowa, Sauk, and Vernon. They located with HHS. yes and no means that they're located in the same building, but they're not in the Health and Human Services building. So if the answer was yes, alone, then they would be in the Health and Human Services
I
building.
probably should have clarified that when I asked you for that, because really I was just looking if they're housed in the same building, because that would be
Mhm.
similar here.
So those again, they're the ones that are adjacent, not with them, but adjacent. Like Vernon County, I spoke with them yesterday. They're located in the basement, and the ADRC is above them, and Health and Human Services on the side of town. So like things like that. So the West Side Square building, the Grant County Administration building, and then the Iowa County is basically also the administration building. He wasn't really sure if they had a title. It was like Ultima or something. It's a communal
Is
service
the
that
Health
they
and
have.
Human Services also located in that building in
Yes.
that- Okay, so it would be a yes
Oh, well,
slash no.
actually, no, I'm sorry, I take that back. They
No.
don't have a Health and Human Services.
So
they're
are
the-
they split into like human services and a health department? Is that how they do it?
They have 6 people in their health department. Actually, I think the numbers are in the,
They have a social services. Is there
yes, social services.
located in the same
And
building?
then, the same thing as that Eagle Country, whatever that thing is. They have one of those. It just has a different
Okay.
name.
So is it located in the same building? in
Yes.
Iowa County? Okay.
Yes. So that's the form that I was put together. Like I said, out of the 9 counties, 4 of them had veterans benefit specialists. Okay. Does anybody have any questions on that?
Committee?
I have a question, a comment on one. Your ETK, at one point you said was $900 and then it went to $918. But then on your reduction, you only credited yourself $450. So should that be $918?
It's per licensed user.
Okay.
So there's
the
2 office
900
staff.
was a 2-year budget.
No, it's if we were to cut the benefit specialist, then he wouldn't have that $450 user. Okay.
And then I was looking at the 10H, the VA expenditures, and comparing with Bayfield and some of the other counties we've been talking about comparison, our numbers are all relatively right in there. The question I have is, you referenced the $12 million a year coming back, but in the compensation and pension, it's only $4 million. What is the other $8 million?
Those are services that provide, including but not limited to hospice care, anything that the VA pays for. It talks about community care. It also talks about in-home health services, some transportation. So it's money that would be saved. But yes, it's money and services that we apply for through our office.
Any other questions on this form? We're gonna continue on and to get to that one that he mentioned, the 10-8.
One quick comment.
Yes, Mr. Seep.
The VA in the past few years, more recent years, especially in the last 2 or 3, has had a very aggressive campaign in online filing for veterans, and that should be affecting the number of claims that the number of services that you have to offer in your office. Are you emphasizing and publicizing the online training? The VA walks people. It's a very efficient system. You can file online and they have people who will walk you through the claim. And it seems to me like that is a great relief for veteran service officers.
Madam Chair, Don, are you thinking about the My Healthy Vet, wanting to get everybody enrolled in that?
No,
I haven't seen anything on claims, but they want you to get online with your VA hospital.
they also are offering online filing for claims.
Perhaps you could refer us that what you're talking about to the CVSO and maybe the committee so that we could look at that, because I don't know.
I understood what
You
he was
know what
saying.
he's talking about?
We spoke about this earlier, actually, during the budget, when the options for reduction, if you want to refer back to that. And it was to cancel computer program contract with ETK. And if you can see in there, for the workaround, I did mention creating a va.gov online account for every veteran and filing through there. So I did address that earlier. However, many of our veterans are not computer literate, and they always say that, well, there's an old expression, I don't know if it's accurate or not, but, that the person that uses their own lawyer, has a fool for a client. Just to say that a lot of times when you're filing these claims, that second pair of eyes, the expert, that's why we do these representatives. That's why we're the power of attorney for these veterans, is to help them.
That's true. However, just to correct something here, the local veteran service officer is not the power of attorney. The power of attorney is assigned through the either the VFW or the American Legion or whatever. The regional VSO or the VSO that is established with those organizations is the one that functions as a power of attorney. That is not the function of a local VSO. That's a misstatement.
If you were to refer to, it's coming up in the forms, the master list. It's called a 21-22, and it's called the power of attorney. What that does is it references an office in Milwaukee, but it lists me as the representative of that veteran. So we go through the office in Janesville, but I'm the one that's actually on there. So if I were to correspond with the VA for any reason during a claim, I would have the right to do that, acting as their power of attorney.
That's right. You're a representative, but you're not a
Okay,
power of attorney.
let's move on unless we have another question on this document. We still have several documents and we want to get to public comment. So 10F.
These are some of the numbers comparing, again, the power of attorney, how many that this is for Iowa County. So Iowa County is an office of one, and these are to reference how many forms they've filled out versus how many forms we filled out. And again, with an office of two, most of the numbers are doubled, showing that services are being provided in our county versus other county. So if anyone has any questions about any of these specific forms, but if you
do actually. So you also have going down, you have Richland in comparison to Crawford. I totaled up the numbers. Is that correct? These are all separate, right? Like these are not repeating numbers. There isn't, you would add it all up to get a total. Okay. So for Richland, I got 510, and for Crawford, I got 494. And I just wanted to point out, I don't know if you spoke with Crawford in particular, but they have two staff, but one is as an admin assistant.
correct.
Did they have, or did you have any thoughts on that?
It's a two-person office, so they're getting double the work done.
So the admin assistant part, I mean, because I know you said that one of the concerns you had was the timing as far as for claims, because an admin assistant can't help with that. So I guess that's what I'm getting at. How do you feel?
An admin assistant that already has a full-time job, and then taking on learning and training. I mean, what her job in Crawford County, this is all she does. She's full-time. So
they have a similar veterans population. I know you mentioned that you felt like if this was reflecting some in the number of claims, is that what you were talking about is on this document?
on the other, all three of them.
Yeah, so
right.
Crawford had 70, or I mean, not Crawford, I 79.
Yeah, if you compare the number of like power attorneys, the one versus 45, and then if you were to go back up and look at the other one, they had a total of 14 while we had 46. So if you look at the disability compensation versus, so that's why I put these in the folder, is so that you can compare the numbers to see what a one versus office versus a two-person office looks like.
Okay, thank you. All right, so then that moves us to 10G.
So talking about specialized, these are some of the forms that the Veterans Benefit Specialist is trained on. These are the ones that we specifically fill out, and that they need to be, we need to be able to fill these out and have to be trained on. So the Veterans Benefit Specialist has a very specific job. These are not all the forms by far. These are some of the forms that we use to reference because we would use them more frequently than others. There are some DD forms in there, which is the Department of Defense. So it's not all VA, but this is a list of the forms. And if anybody wanted to search them online on va.gov, then you would be able to see them, and they are not easy to fill out, which is why.
Can I ask a clarifying question? These are all ones that only a benefits specialist or yourself can fill out?
That we would be trained to fill out.
I know, but there are certain things that only a benefits specialist can, but an admin assistant could be trained to fill out some. Does this include any that an admin assistant could be trained to fill out, or is this all specific to just a benefits specialist?
No, this is what anybody could be trained, but they have to be trained. So they couldn't have another full-time job. This is be a job all within itself.
Right. Any questions from?
The advantage of that over the administrative assistant is they would be able to file those power of attorney forms, and they would be able to log into VBMS under the federal system, and they'd be able to find them. Not to mention that they'd get that federal accreditation, which there is no cost to.
NH, I have a question on this one because I want to know what they're referring to. My question, it was all pretty self-explanatory except for the unique patients. What is that? Because I see veteran population, and what is unique patients? Does that mean presenting to your office? Does that mean something else?
So for the people that can't see the screen, it's where the commas are is, oh, thank you. Where the commas are actually millions marks. So where it says compensation and pension, where it says 5,370, that's actually 5 million. Just for anybody that's not sure how to read it, it lists the population at 1,176 for Richland County. So as far as the unique patients, can you scroll down just a bit to Richland? There we go. So the 467 unique patients, correct me if I'm wrong, Clint, but I think that refers to how many that are receiving benefits at any one given time as far as the disability compensation payouts and service. Am I wrong on that?
That clarifies me. Does that-
I'm not sure exactly what the data point, if it's enrolled in VA or if it's active in VA or if it's receiving benefit.
Compensation, I thought that's what the unique patients was.
Questions from other people? I think the last one you had uploaded was the green book. Was there something you wanted to reference in that?
Not sure of the page number right offhand. I was asked to add this so that the committee would have reference to it. It talks about veteran populations and how those were figured. I don't remember what page it is though, but it was.
I think it's page 16 and 17. I opened right to it.
And so that was just to also be included for committee consideration.
Okay, so at this point, I think as a committee, because again, I don't think we're going to be making any solid decisions on anything until next meeting. However, I want to know what questions you might have. Is this, of the various options that were presented by Cvso NOC, is there more information you need on anything? Is there something that you want to just immediately think that we don't need to consider, or I just need to hear your thoughts. Where do we go with what information that we've been presented?
Madam Chair,
Yes, Mr. C.
the ETK system was just recently installed within the past year or so, wasn't it?
I believe it was July of 2020. I think it was July of 2021.
And at
I'd
that
have to-
time, it was requested and you found it to be very helpful. Is that correct? And
Correct, and it was
and-
also suggested by other county CVSOs.
you're right. And you said that you were the only county in the state that didn't have it.
That is correct.
And And it seems to me that since it adds to the efficiency of your office, we might want to consider not consider removing that from your office. I think that you would find that to your advantage. It seems to me from what you're saying, to be able to keep it.
I would agree. It is advantageous to my office, and I appreciate your comment. I wanted to make sure that all of the options, of things that I could lose and still be able to operate efficiently, it would definitely make me more efficient if I were to keep that program.
Good clarification. Other thoughts or comments?
I have one, since we have Chairman Marty and Administrator Clinton here. Going forward, for clarity, and I'm talking letters that have been written, what this committee is going to decide next month is recommendations that will have to be implemented if the referendum fails. Now, bear in mind if we go to referendum, which I think that's probably going to happen. So I'm putting it back on the letters to the editor. When the referendum comes out, you should be out lobbying your neighbors to vote yes on the referendum.
I would clarify.
Is that a fair assumption?
We
I'm just
haven't,
trying to clear the air here. There's a lot of stuff going on.
we haven't made decisions yet, though, on which portions of this would go to referendum, would be my one clarifying statement.
Correct. Just to clear, that there may be things that you want to recommend as reductions without consideration for referendum. There may be things that you want on a referendum. And then the understanding too of things that are going to be placed on a referendum, you may be doing it without if the referendum were to be a fail.
And I would just say that her initial recommendations for whether it goes on referendum or not, and the reductions are on this document. So that's what we'll need to
So
discuss.
we may out of this committee take it on to ad hoc committee and say, this is the recommendations that we recommend, go. The ad hoc committee could then say, no, we're not going to do that. And
Well, yes, and then ultimately finance and personnel has say on
Yeah.
that as well, correct?
Yep.
And then on to county board. So
Yep.
there's like 3 levels after this.
Yep.
Yes.
And Madam Chair, my comment would be, I cannot support a referendum unless we have taken every step to consolidate, to save, to pare down. We can't go to the voters and say, hey, we'd like to continue doing the same thing we've been doing for the past 100 and whatever it is years. We've got to say we've taken these steps and this is where we are.
So for our committee, this has been a lot of information to digest, but at the next committee meeting, we would need to make that decision on what are we doing and then what are we recommending for referendum or not. And so is there any other information that you need or would want discussed prior to that? Or do you feel like what we have here is a pretty good picture? Now, obviously, we're going to open it up for public comments after this as well, so we'll have that to take into consideration too. Okay. Well, with that then, I think we'll move to as far as the other agenda items. So that would take us to the public comment portion of this. So I have a list here of those who want to speak. It looks like we have about 4 people. Okay, so I'll have you sign in. I'm going to start. Do you know which one of these was first? I like to go in order. Okay, so if you want to add your name here, I'll start on this one. We'll have you step up to the podium. I'm going to ask that it be about 2 minutes, just because I know it's been a long meeting, and depending on how many people want to speak, we want to make sure that everyone who wants to can get an option. I'm going to go in order by what's on the list here. Is there anything else I'm neglecting to add? Okay, so who I have first here is Bill Lobeck.
Good morning, and thank you for listening to my views. To begin with, sitting here this morning, and listening to what was discussed, it comes to my opinion that it is the opinion of this committee or these committees to bail out Health and Human Services at the expense of the Veteran Service Office. We're going to cut service for the veterans to remain giving services to the health and services. And that is basically, without getting political, our supposedly called vice president has made the comment that she wished to completely do away with veterans benefits and giving that money to health and human services and illegal immigrants and all such ways. And that is totally against my part. Also, this is just a step in that direction. I'm getting very political. This is Richland County, not Washington, D.C. And the people in this county have a voice. And believe it or not, there's a lot of veterans in this county that are totally upset with what is happening. Thank you.
Thank you. All right, next on my list is Marge Freeman.
Madam Chair, I've revised a lot of my comments, so I'll be as brief as possible. Those that have attended, the veterans behind me have all served either Vietnam, Desert Storm, Iraq, or Afghanistan. And any information and numbers I give you is all open source or from previous meetings that I have attended. It's difficult to understand our Veterans Service Department is being addressed to be moved to Health and Human Services. In my eyes, and many of us, we feel that it will discourage veterans from seeking out services they so badly need. Many veterans wish to go to a neutral and anonymous location for privacy and do not want a location change that may portray labeling or stereotyping. The understanding is to take away the part-time veteran service benefit specialist, which in turn will cut services and limit office hours. The office needs an accredited office personnel. And our question is, if somebody else is to assist at Health and Human Services, will that individual be accredited and or certified? I certainly do not want, and many of us do not want, our DD-214s and other information reviewed and overseen by somebody that's not accredited or certified. Our county has over 1,000 veterans and constantly increasing. These numbers does not include deceased veterans and the family members who also receive services. The Department of Revenue, as mentioned, has received over $100,000 in property tax credits to Richland County in the last year, in part due to Veterans Service Office assisting with those services. The Veterans Office budget is around $78,000, and they want to slash it in half. Why are they focused on one of the smallest budgets in the county and attempting to prevent veterans from seeking care in an atmosphere of privacy? Many, and in closing, in this county, many veterans in this county are against moving the veteran service operations to Health and Human Services building and support the continued employment of their part-time service person in addition to that. We feel there will be a negative impact to those who have needed help and through the VA system. Uncertified employees should not have access to our DD-214s or other private forms. I recommend this issue go in form of a referendum for the county voters and all veterans to vote on it. Thank you.
Thank you. Next I have, I believe it says David Lundgren.
Well, I'm not as poetic as Marge Freeman with this, but being a resident of Richland County for 20 years, I have 21 years of service, Wisconsin National Guard, multiple tours overseas in Iraq and Afghanistan. My generation is hitting really close to needing those services, and coming here to this courthouse has been, well, to this building has helped me out tremendously. I didn't have a good channel of where to be directed when I needed services. And with the help with the VFW, some American Legion members, they guided me here to help me seek those programs and other stuff that I needed in my case. My generation coming back, we don't have a good way to adapt to change. And by the time the location changes and veterans are directed to go across the street or wherever, that's a lot of time to cover for us. 22 veterans pretty much every day commit suicide. They need to have these programs accessible right away. They can't have that change to, I need to go here or here or here or here. We need to kind of keep it the same. Maybe think financially, when you guys make your decision on how you're going to shift around these programs or the Cvso department, take into consideration that them seconds and those changes could be someone's life. You know, I can speak to Miss Knock or the assistant, Mr. Kern, I think his name was. Yeah. So soldiers can speak to soldiers. I'm not going to be able to speak the same jargon that you guys would understand, but talking to another soldier is going to make it more personal with me. Now, me personally, if I go and I talk to a normal civilian in the way I speak, they're going to find it aggressive. They're not going to be able to handle that. Soldiers speak to soldiers, especially combat veterans to combat veterans, not veterans to combat vets. We speak differently. So take that into consideration with moving and allocating funds and stuff like that. That's all I really have. Sorry, I wasn't more poetic with my words.
Thank you, Mr. Lundgren. Next, I have Larry Sobronic.
Thank you. One thing, you talked about the flag, saying I pledge allegiance. I've been on that commission 12 years. Previously, we did that every meeting. So somebody in between, I left the county board and you took over, somebody dropped that. I mean, this is just at the commission meeting. One thing, you know, we live in a free country. And if you people on this board appreciate that, leave that lady's office alone. She's helped every one of us get benefits. Ken sat there and talked about pennies. Look at the money that's coming into the county from our benefits for us serving in combat and having something wrong with us. How much more would you be looking for? Another thing, you talked about moving Health and Human Services. There's a little discrepancy in what you talked about doing the clerical work. It sounds to me like, as always, H&S has always had a few cats sitting in that front office, playing on their phones and needing something to do. Because I know that for a fact, when I was on the board, we would go over there and there would be gals sitting there playing on their phones. And I saw it. And one more thing, Don Seat wants Karen to do more documents, and yet he wants to cut her pay or cut her benefit specialist. I don't understand where he's coming from. Thank you.
Thank you, Mr. Sobronic. Last name I have as a yes was a Dominic Anderson.
Thank you. Is it Chairwoman? This is the board. I appreciate it. First of all, as you said about Don Seat, keep my personal comments personal to myself, but he wants, I don't want him looking at my paperwork. I don't quite care to have anybody else look at it. It's personal, it's private. I don't know how HIPAA would come involved or not, but if she's ordered to document what I talked about and provide that to people, I will look into suing the county. That's personal when I go to talk to her. If she wants to mark down that I'm a person that came in, fine, you can have that number, but it's no one's damn business what I'm talking to her about, what I'm trying to get done. unless it's a public record. So your eyes don't need to see what I'm filing. And then he talked about efficiency. Well, if you want efficiency, then you wouldn't be trying to get rid of the part-time guy. What I would like to say is that, you know, if you're not a veteran, you don't get it. That's fine. And even people who serve but didn't serve in a combat zone don't get it as much as people who did serve. And you know what? Even I don't get it as much as what I call true veterans. And you know, sometimes I call them, I'm a veteran. I mean, I served, I went and I did my time. It was a miserable time over there. A couple situations, but I didn't have to shoot at anybody. I didn't get shot. You know, this guy's a true hero you have in your presence here. And I won't tell you about his background, but the guy's a true veteran. He's a true hero. And it's people like that I'm really worried about. I used to joke that, you know, you guys have heard me say it, that I only have PTSD, but my wife would say I do. Well, maybe it's just undiagnosed. I don't know. I can get kind of crabby too, but if you had only 1% of us serve, okay, you're spending all this money, and I'm not saying it's wasted. I mean, if we had unlimited funds, it'd be great. Have more, you know, courts for drunk drivers and stuff like that. But what you don't realize is when you're doing the matching grants, right? And then you want to do more. That's great. But tell the person that's losing their house because of inflation and gas that you want to do more and you have to that matching grant. Tell the people that are going to be on homeless and have to choose between food and gas right now that you should be providing these other services. And then you say, well, what's the difference then between you and a veteran? Hey, we put our lives on the line. We went over there. I'm not a hero. I signed up for the college money because my wrestling buddy said he was getting college money. But you know what? When they told me I had to go over, I didn't run to Canada. I figured I might die. I mean, what we were filling our heads with when we went over there. So we pushed up our wedding. And, but anyway, you know, I really thought that could be the end. I still went. And I did my job. And if I had to be in a position where I would have got shot at, I would have went there too. I was willing to do it. We all signed up to put our life on the line if needed.
Mr. Anderson.
Am I over?
I don't want to cut you off, but in pursuit of fairness, you are over 2 minutes.
Okay, the last thing I'll say then, just real quick, is we can't fill out those documents. I mean, you know, it's like she said, an attorney, you got an idiot who's a client if you fill out whatever. If you don't fill those documents out right, the VA and these third-party people they send you to, they look for reasons to reject them to save money. They have to be filled out properly. We need to keep our staff. Thank you.
Thank you, Mr. Anderson. Okay, I have a Rhonda Rout as a maybe. Would you like to speak?
I would.
Okay.
I'm not a veteran, but my dad, Gary Gale Glassbrenner from Grant County, was Army. I don't even know all the terms, but he was in the service, and I am engaged to one. And all I can say is these people have already been through enough. Don't put their resources in the tank. She shouldn't even be up here against, I can see budget cuts. I own a business. I can see budget cuts, but there's a limit, and it's only going to get worse where we're at right now in our country. It's not going to get better. And people need to start appreciating these veterans, all of our veterans. That's all I have to say.
Thank you.
And I'm sorry, but
I'm sorry, Mr. Anderson.
But some veterans.
Mr. Anderson, there's someone else on the list.
Some veterans may say they will, but I'm telling you, some that need it won't. So just because one veteran might say they will, that doesn't mean they
Okay.
all will.
Mr. Durst, David Durst, did you want to speak? Is he here?
I think I'd make his own.
All right. Well, I want to thank those who shared today. We were definitely, and the last time, we are listening to you. We are taking this into consideration. We appreciate your comments and what you represent and what you've done for our country. So thank you for showing up and sharing your opinions and your thoughts. I think I am going to move on to agenda item number 11, which is future agenda items. Is there anyone on the committee who has something that they wanted added to the future agenda?
I'm not on the committee, but can I address the committee? There were some people that had some concerns that they wanted to be here to witness some of these things and hear these things, but they had to work. And so they would like to consider perhaps the next meeting if we were to be able to hold it after 5 p.m. All I'm doing is putting it, I just wanted to make you aware of that,
Okay.
whether you take it into consideration or not.
Okay, thank you for that. Anyone else?
Madam Chair?
Yeah.
I'd like to learn a little bit more about Health and Human Services, if they're HIPAA compliant and have a locked medical records room and have licensed staff, just like they would have at the VA. I want to compare the VA's psychiatrists to their, and their credentialing to our credentialing. See if it's comparable.
Certainly, we can, I know as we need to make some decisions next time, we can discuss the logistics as far as what does that look like with HIPAA when we're talking about veterans. I'm assuming that's what you're asking, what would that look like? And also where the potential office, if we were considering that, could be located. We can include that in the discussion because we didn't really cover that today, but those were things that were discussed.
Could we also have maybe a brief background of our current veterans and the support that they've provided in their years of service?
I'm sorry, say that again?
Like a profile of our veterans that are on our committee right now. Could they just have a brief introduction of how maybe they are serving in veteran service organizations, how they were in the military and what ranks that they were, and maybe that might shed some light on maybe that people on this committee do appreciate veterans and wouldn't want to see any less. I think Sherry Hillesheim's got an excellent background in her military service that maybe our veterans don't understand.
Okay, thank you. Anybody else?
Just specify the Code of Federal Regulations that specifically covers the VA and its entity. We can't be combined with other departments' medical records, but if there's something from there that you would like to pull that I can present to you, then I'd be more than willing to do that. If you just let me know exactly what you're looking for, I can pull it out of the federal regulations for you.
All right, thank you. Again, thank you to all those who came. I know some of you would have liked to speak more than once, but again, in view of being fair on how we present public comment, we allow everybody one chance to speak.
I don't want to speak, but I do have a question for you, though.
I'm sorry, at this point, we're not taking questions, but I could speak with you after the meeting if you would
Well,
like.
is the referendum going to be separate, or is it going to be one referendum? Are you going to stick the veterans questions on with all the other referendums, or separate? Because they might want to support the veterans, but they're might not want to support everything else. So I would ask you to make those.
Thank you for that question. I can certainly refer it to the referendum ad hoc committee. They would be the ones to best answer that question at this point. I'm sorry, this is not, I will. Sure, our next meeting is the next regularly scheduled meeting of the HHS, which will be this. No, it's moved to 9:30. So second Thursday of October, which is the 13th at 9:30 will be the next meeting. Okay. All right, thank you all for attending. I need a motion for adjournment. Second? Second, all right. All those in favor, please say aye.
Aye.